least one person. I'm not sure if they've attended a committee meeting before. So the agenda and the materials for tonight's meeting are public. They're also can be viewed on the CB4 website. If you're not signed up for the e-blast, I always encourage people to do so. There's basically three things. After each presentation, first the committee is going to ask questions and comment. Then members of the public or attendees get an opportunity to speak. Number two, in order, if you want to speak, you need to raise your hand. So press the raised hand button on your screen. And third, after the attendees, the discussion goes back to the committee for the business session. And on some items, we vote and we write a resolution that's next going to go before the full board meeting for a vote. And like Joe said, we have a full agenda tonight, and we are starting with, I'll let Joe take that.
Yeah, I'll put up a full agenda so people can see it. We have 4 items tonight. Presentation by Ryan, Chelsea Clinton, Community Health Updates. Our main item tonight is a presentation by Department of Homeless Services and Acacia Network on the Skyline and Travel-In temporary homeless shelters. A small follow-up report on the Slaughterhouse mandatory inclusionary housing application. And then a important item, our final discussion on Board 4 Statement of District Needs and Budget Requests. I want to note for members of the committee, we're allocating times because the majority of our time is going to be spent tonight on the Skyline and Travel-In. So for the first item, we have 10 minutes allocated both for presentation and questions. Caution the committee members, we cannot spend a great deal of time on this matter because we have to give both community members and the public the ability to go through the whole presentation on Skyline and Travel-In and then be able to ask questions. I'll take this down. I'm going to turn it over to William Arboleda from Ryan to give us an update and take it away.
Will, you're on mute.
You're on mute, Bill. You're the fourth.
I had so much to say there. I'm sorry. So good evening, members of the committee, co-chairs, and members of the public. My name is William Arboleda. I'm the Deputy Director at the Ryan Chelsea Clinton Community Health Center. Originally, this item was supposed to be our Executive Director, Dan Pitchinson, giving a regularly scheduled update on what's going on in the center, but unfortunately, he's up in Saratoga at a conference for a state primary care association. So I'm going to fill in a little bit and just really talk briefly and take questions on the asylum seekers who are receiving care in the neighborhood. All right, so we've seen a large influx of asylum seekers coming to get primary care. It's been going on about probably since, I don't even know, like I guess late July, right? They were coming in slowly with a trickle. We met with the city a few times to begin coordinating. We did get a lot of coordination. They would actually call my cell phone to say we have 5 people coming in, we have 3 people coming in, and they would give us names. Sometimes they'd come, the patients would come, sometimes they didn't, but the overwhelming majority of folks who came in just came in off the, you know, I don't want to say off the street, but basically they came in without any heads up, right? So, you know, we've been registering patients, sometimes anywhere from 10 to 20 a day. Over the past couple of weeks, it's seen a slow trickle. Luckily, we've been able to handle everybody coming in, getting them registered the same day they come in, if not an appointment on that day, or definitely within the week. But it has been it has been difficult due to our limited resources, right? So, we usually see anywhere from 175 to almost 300 patients a day, visits a day. All right, so on a normal day, if we have 10 or 12 asylum seekers come to get services, that tax is not really so much our clinical resource, but our administrative resources, right? Folks getting registered. In the beginning, they were coming in with presumed insurance. Now they're not even getting enrolled in insurance. We're getting a lot of folks who are not being enrolled. So that makes it more difficult to get them enrolled in Medicaid and such, because it's a long process. And we only have, probably in the whole center, we probably only have about 3 or 4 enrollers who can enroll in Medicaid. So once we get them registered, again, we get them seen probably within a couple days. We've created a workflow mostly for our pediatric patients because a lot of kids need immunization. We're trying to get them into schools as much as possible. So we sort of have a nurse's visit where we triage them and find out what their needs are, because that was also slowing down the system. Having the doctors ask those questions really slowed us down. So we figured we've got that going. Also, mostly folks are being seen for primary care. There is a good deal of women's health and contraception, reproductive health as well. And actually, not to put this lightly, but like a lot of injuries, right? Injuries like, I hurt my knee while I was walking in the jungle on the way. People are walking here from Venezuela. I think, most of the asylum seekers we see are from Venezuela and also from Colombia. That's where we've been receiving. So, so it's sort of those injuries and, again, primary care. And, again, it's lessened, the amount of folks coming in on a daily basis for registration has lessened over the past couple of weeks. It's still a good amount, but now we're seeing they're part of our patient population. So now they're in the system, they're getting services. Another barrier which we're trying to help with is prescriptions, right? So folks get enrolled in an insurance plan, right? But it takes about 60 days to get them fully insured, which means they have to wait 60 days to get prescription coverage. We've, even with our 340B program, which is extremely important and beneficial for us operating the center, our partners and, our pharmacy partners, but specifically Thriftway across the street, are helping us, with the coordinating to cover the cost. Because even with the 340B plan, a prescription will cost $20. And, the asylum seekers don't have that money to cover it. So we've been covering that, and hopefully we'll get reimbursed somewhere down the line. But we're covering their initial prescriptions.
I'm so sorry to interrupt. I'm so sorry, Mr. Arboleda. Can you point out whoever is logged in under Alfredo Matthews' name, because that's not him, and the real Alfredo Matthew can't get in. He needs to.
I have no control over.
No, not you.
I'll have Nelly deal with that. Yes, no problem.
I'm so sorry.
No problem. Thank you, Amaros. Go ahead, Will.
Yeah, so we've been, from a clinical standpoint, we've been taking care of that. Our staff has really stepped up and done a tremendous job of receiving and registering and having these, the asylum seekers become part of our clinical community. They've really stepped up. Our doctors, our nurse practitioners, registration staff, nurses have done great. Another item aside from clinical is basically trying to get clothing, right? They've been asking for a lot of clothing. They say, we don't have this type of, we don't have men's clothing, women's clothing, children's clothing. So our staff really, just not even advertise. They just decided to start bringing clothes in. They recognize the need. They see on a daily basis people registering, and what their needs are. And, we've dedicated a whole section to folks to pick out clothing and shoes and socks, and we've gotten donations from Direct Relief. Today, Assemblymember Rosenthal's office has come, dropped off, diapers and other items. We've been working with the schools, to help get the students, whatever immunizations they need as well, PS51 and PS111, for example, specifically PS51. We're working with the parent coordinator and the principal there. They're just sending us for the direct pipeline for whatever they need. So that's pretty much what we're doing and what we're up against in a nutshell. So I guess I'm ready, Joe and Maria, to take questions.
Yes, so to question our members, we have 3 minutes left. We're going to extend this a little bit further, but I'm going to be timing it. Dolores, followed by JD.
Yeah, my question is very direct. Will, obviously there's so much going on. Are you able to put together a laundry list of the things that you need and where you think our advocacy can do the most? I mean, the reason why I say that is clearly we can write a letter and be on record, but we need to know what levers can be pulled, considering that you're a federally qualified health institution. There's obviously certain areas of support the channels that you go through. So getting a list of all of the things that you think that you need now to fill the gap, for us to directly advocate for that would be really helpful.
I could definitely, yeah. I mean, I can go down some of the laundry list here, but I mean, I can,
Maybe you could just submit it and then we can
Yes.
just disseminate it.
I will put that together. Thank you.
And just for everyone's information, the board did meet its executive committee with HRA and the mayor's office on the whole humanitarian crisis over asylum seekers. They gave us as much of a briefing as they could because things keep on changing. And we made a specific request for FEMA funds to come to New York City to cover these costs. And in that discussion, we highlighted Ryan Center and the schools as major recipients of funds because we cannot manage the need if we don't have the resources. And we have classes hitting 38 in PS 111. So this is a serious matter that's affecting our district it's a national matter affecting our district on a very local level. Betty, and then JD.
Hi, quick question. Thank you for all your efforts. How do you handle vaccinations for COVID?
Well, we have Pfizer, we have Moderna. If you have a visit, you can get your vaccine during, you can get your vaccine during your visit.
I think she means for the asylum seekers, Will.
Oh, so a lot of them have come already vaccinated. So, with whatever they need, and it's done within the visit. So just like a patient, if they come in and they need the vaccine, we give it to them right then and there. If they want it another time, they can make an appointment during our vaccine clinic hours. So it's straight for just like any other patient. So the asylum seekers are treated and they're getting the same services that everybody else does. So if they want it right then and there during their visit, they get it like that.
And if I have clothes, can I bring them and just drop them off at the
You can
Ryan
just drop
Center?
them off to me. You can just ask for me, or you can drop them off with our security officers in the front.
Okay. Thank you.
Thank you, Betty.
JD?
William, first of all, you're doing a heroic job. Your staff, congratulations. You guys are great.
Thank you.
I have two questions. One is, again, we are a community board. There's also a community that uses your services. Can you reassure us that the community that already uses your services is also being adequately taken care of along with the asylum seekers? If not, what do you need?
So we actually are, we have not had any, there's no, the asylum seekers have not created any barriers. What happens is in the beginning, when we were getting phone calls from the organizations who are doing the intakes and says, oh, we'd like this person to come at this time, and setting up those appointments, we fill those empty slots, right? And then if they don't come, then they go unused, or, so that is, so we haven't, we've tried to rely less on and we've gotten many fewer phone calls. So, that was the only time when there was a barrier or created any less services, that we would fill up slots that were open to anybody for asylum seekers, and they never showed up for whatever reason. But that's happening less now, and folks are just walking in.
That's terrific, and we want to take care of these folks as best we can. In the future, do you anticipate more asylum seekers because of the 49th Street take-in center coming to Ryan? And if so, do you need more money, more help, more doctors, more something?
Yeah, we need all of that, but we also need more space, right? So we've already, even though we just had as all of you know, we just increased our space by about 6 or 7 rooms. We've already run out. We've already outgrown the space that we just expanded 2 years ago. So another site, and this is, again, blue sky, right? Another site to increase capacity is something to look at. Funding to get, there are plans, we do have plans on paper to expand within the center, but we just ran out of the funds that were given during the last transformation grant we received. So space, we can have all the doctors and we can get all but if we have nowhere to put them, I don't want to put them out in tents on 10th Avenue.
Great.
Will,
Thank you.
have two questions for you. What is your percentage increase of clients that is related to the huge surge in asylum seekers?
So I
Approximate.
could say approximate, we've probably increased, and we stopped keeping count that, but we're probably up around 350 individuals who we've registered over the past couple, which doesn't seem like a lot, but when, you're a mid-sized community health center who's already seeing 200 people a day, it's.
But what is that on a percentage of visits? So we get
Oh, percentage. I mean, I think so. Year over year, we've seen, we've seen almost 10% more patients than we had at this time last year.
Okay.
Whether that's asylum seekers, I don't have those raw numbers to drill it down that specific, but year over year, we have grown almost 10%.
It would be helpful with the board trying to assist the institutions that are being impacted on this. If you can get us rough information on that, so we can be pressing the federal government to make it clear that if X happens, there's a Y need, and we need to come up with a Z funding to meet that need, because that's the equation. Simple as that. Are you interested in even having temporary space for your needs given this crisis?
That's something to look into. Again, we're at capacity now, but I mean, temporary space, we would probably need other resources, like, JD said, more providers and nurses. Right. I mean, we do have, even, take away the asylum seekers, we have an extreme nursing shortage, which, we have
right over and above that.
Yeah, so that's just a baseline need is nurses. We're short right now 4 nursing lines. So.
Sabrina, you'll be our last question. Go ahead.
And Joe, I'm sorry, Sabrina, I'm going to move over Erica Overton from Linda Rosenthal's office.
Sure.
Assembly member.
Sabrina, go ahead.
Yeah, sorry, I joined late. I don't know if it was discussed earlier, but I'm curious to know if you referred out when you cannot meet the needs to any of the city hospitals, because I know city hospitals are getting tons of funding for specifically for the asylum seekers.
We haven't, as far as I know. We do refer out for specialists, right? So
yeah, for specialists. Yeah.
So, I mean, we do have our internal network of specialists. So we do have, we have podiatry, we have dermatology, we have GI in-house. So they get serviced in there. If there's something that we don't cover, we'll go to, we'll try to find. We do work with HHC on some referrals. Usually we try to send to Mount Sinai, but it's sometimes difficult for Medicaid patients.
Yeah, because I know that HHC is getting funding for asylum seekers.
Yes. I mean, but even for our Medicaid patients, we usually we try to refer out to them as well. So that's, yeah, they're integrated within our, once they go through their initial visit and their consult and everything, they're just patients of ours. We don't see them, and whatever needs.
No, I understand. I'm just saying, like, because there's funding that is going directly from this for the asylum seekers to HHAC. So I'm just trying to, as a funding.
It's still early, but I can try to get some information on that and get back to you.
Well, thank you for coming tonight. Please keep the community abreast as to the nature of the problem, so we can assist you whenever we can to meet this new unexpected need. And the more detail we have on needs, it's better for the board to engage to lobby on your behalf.
Thank you very much. And thank you for your support and for the time.
Yeah, we're going to go, by the way, we did pretty good with that, 24 minutes, a little bit more than we thought. Let's go to our next item, which is DHS and Acacia Network, Skyline, and Travel In. I want to ask Leilani first. We have everybody here.
Wait, I'm sorry to interrupt. Erica, Maria, did you want to say something about Ryan before we move on?
I really have to ask Erica. Erica, if you can wait on this, because we're on a heavy duty schedule tonight. And if it's not something that is absolutely needed to be said, it'd be better to hold it. Okay.
It's not about Ryan. It was just the work on Skyline, but yeah, I can hang on.
Yeah, and we're gonna we're coming to that next.
Okay.
So Leilani.
Hi, good afternoon. Can you hear me?
Yes.
Good afternoon, everyone. I think that we're waiting for just one person from the team to join, who's a crucial voice, Marika Scott McFadden. I'm not quite sure. Is Marika on?
Marika, I certainly seen her before. I'll look in the.
Katie.
Hi everyone. Good evening. Marika is just having a little bit of tech difficulties with the link, but she's working on getting on. We can proceed, and I can take lead for now.
So yeah, so if we can do intros at least in the meantime. Leilani, your team. First, why don't we go with the DHS folks, and then we'll go to Acacia, okay?
Sure, I'll introduce myself. For those who don't know me, my name is Leilani Irvin. I'm the Manhattan Borough Director for the Department of Social Services. I'll kick it over to Haley.
Good evening, everyone. Thank you so much for having us today. My name is Haley Nolasco, Assistant Deputy Commissioner of Intergovernmental and Legislative Affairs at the Department of Social Services. And I'll now pass it on to my colleagues over at DHS.
Good evening. My name is Cindy Tita. I am an Assistant Commissioner for Single Adult Shelter Operations, and I'll pass it over to my colleague, Nicola Hammond.
Hi, good evening. Nicola Hammond, Associate Commissioner for Transitional Family Services. Passing it over to John.
John, you're muted.
Good evening, everyone. John Hammond, Program Administrator with DHS, partner to work with Acacia at Travel In.
Anyone else from DHS?
Melissa is Melissa on?
Melissa was having some technical difficulties, so she's trying to get on.
I see her in the room as an attendee. She did not in as a panelist.
She could be raised up. Melissa Ramos.
Yeah, bring her over, Nellie. Thank you. Thanks, Leilani. Anyone else in the participants that you can see, Leilani, that's a DHS or Acacia person?
I'm checking.
Okay. In the meantime, let's continue with introductions. Anyone else from DHS or HR or HRA? Also, sorry, go ahead.
I think we're good.
Okay. I just want to note also we've been joined by two other committee members, Katie Stokes, member of the committee, and Pete Diaz, member of the committee. And Hector Vasquez just joined us also.
And also Aurora Cruz. And
Aurora Cruz joined us.
And
great.
Sabrina Rebron.
Yes.
Who spoke already.
Aurora, just rename yourself so you have that you're part of CB4. If we could now go to Acacia for introductions.
Hello, how you doing? My name is Alfredo Matthews. I am Senior Vice President of Transitional Housing for Acacia Network. Amaryllis.
Hello, everybody. I'm Amaryllis Soler, Assistant Vice President for Acacia Network Housing, and I supervise the families with children sites.
Stephanie Bennett, Program Coordinator, Travel In. Camilla.
Good evening, everyone. Camilla Nelson, Program Director for Travel In. Passing off to China.
Good evening, everybody. China Rivera, Program Director over at Skyline Hotel.
And that's all our intros for now. Thank you.
Perfect. Okay. So Leilani, you want to lead off and then we'll pass it to Acacia?
I'm going to turn it over to Haley Nolasco.
Oh, Haley. Sure.
Yes, thank you so much. Yes, and Deputy Commissioner Marika Scott is on the line. She's just unable. She's called in, so she's listening in, but she's still trying to get in the Zoom link. But again, thank you again, everyone, so much for making the time this evening to hear from us. We're happy to be that we are working to submit written responses, so we are ready.
Haley,
today.
Haley, one
Yes.
question is Marika a phone number? And if what it
Yes.
is, we can bring her over.
She's 929-388-9597.
Okay, Nellie, bring that. It's that third number. Bring her over. Okay, thank you, Marika. Thank you.
Thank
Haley.
you. Thank you so much, Nellie. While Marika is being moved over, we just wanted to let everyone know that we definitely acknowledge that we were submitted questions by the community board, and we are happy to speak to those questions today. We are prepared to speak in response to them. We do not have the written responses as of yet, as they're currently being vetted, but we are planning on sending them shortly. So you will be receiving our written responses shortly after this meeting.
And I just want to remind everybody in this meeting that we had an emergency meeting July 29th. We had a series of questions. That's what Haley's referring to. It's for DHS, not for Acacia. and we expected to have those. Molly Park in that meeting said we would have the responses by September. They were not ready for October. So we want to say to you gently, but clearly, it's 2 months. You have to respond to us. This was an unexpected arrival of these two shelters, and we need to know where we are from the DHS side, not only from the operator side. All right. And I also want to set the stage for all of our committee members here and the public. The issue in front of us tonight is how the shelters are operated, how they landed here, how we're dealing with it, how they're integrating. But also remember, we're not talking about whether asylum seekers are a good or bad thing. I think all of us agree from a baseline, this is something that we as a community and we as a city have to deal with. It is being sent to us by as a political matter from other states. It's horrific, but our question for our community that we bring to you over and over, DHS, for HRA and DHS, is that we have a concentration of shelters. It doesn't matter who is occupying them. There are too many concentrated beds in one location, and therefore it is an overall social service problem and creates, to a degree, a public safety problem depending upon the individuals. I will note again, as I noted in the July 29th meeting, that we have less issues with the current population at Skyline than the prior operation during COVID. We have more issues on Travel Inn with the population there, and we need to remedy them. And the overarching issue that we raised in July 29th is that we cannot accommodate as a community all these shelters at once. How do we distribute them throughout the city while now still needing to manage this incredible humanitarian crisis that we have of asylum seekers? We see the mayor is trying to do this and open new centers, but again, our neighborhood is not the only location for them. So I'd like to, Haley, do we have anything that we can talk about that in general before we get to Acacia on the operation of these locations?
Yes, definitely happy to speak about that generally. As we all know, we are, and thank you so much for sharing your concerns and also for calling this a humanitarian crisis, because it is definitely true that we are currently facing a humanitarian crisis. This was definitely unprecedented. New York City has been seeing very high amounts of asylum seekers coming from the border on a daily basis. To date, we've had over 16,000 individuals that have come through our shelter system. So definitely wanted to start from there. Since May, we've actually cited 52 emergency shelters throughout New York City. So it is definitely important to us to know that we definitely do not want to concentrate shelters all in one area. And we do want to call on all New Yorkers and communities across the city. And the mayor has also mentioned this as well, to really help us in, all sharing the part of creating shelter and providing sustainability for our most vulnerable. So definitely hear you on that aspect. Within the 52 emergency shelters that were cited, one of the emergency shelters are within Manhattan Community Board 4. So just again, reiterating our commitment to
Haley, we lost you.
Finding neighborhoods and guide shelters. Can you hear me now?
No, yeah,
Are you able to hear me now?
You broke up for a key sentence. We didn't hear that.
Oh no, I was right there. I felt like I was hot for a moment. But I'll reiterate the part that I mentioned. I'll just surmise it very briefly, where we're just working, just wanting to reiterate that we understand the concern around oversaturation. During this humanitarian crisis, we have cited we have cited 52 emergency shelters. Out of those 52 shelters, one was cited within Manhattan Community Board 4. And that's again to show that we do have a commitment of citing shelters to meet our legal and moral mandate to provide sustainability and shelter to our most vulnerable, especially given asylum seekers, which we know have a different set of barriers that we are also working to support them with. So just wanted to give that overall view of where we are. We've had, I'm not sure if you all heard this, it may have broken up, but we have seen well over 16,000 individuals come through our shelter system since May, just so that you all can, see the magnitude of what we're really facing during this time, because we are definitely facing a crisis, and we are working to our best to be able to respond.
And we also received communication from City Council that they proposed additional shelters in our district. Are you aware of that? And do you have any proposals for any additional shelters for hotels in our district?
At this time, we can say that we are still looking for neighborhoods and communities where we can, again, continue to meet our mandate to provide shelter. At this time, I do not know of a shelter.
Haley,
I think you
Yes.
froze again.
I think
Oh, no.
I think you should try maybe if you go off camera, sometimes that helps with the.
Okay.
Because we're getting like 3/4 and then you say something at the end and we're losing the end part.
Okay, let's see without my video.
Yes, that's right. So again, and then we have a hand raised by Sean Coughlin from our council member, but it was the city council president, the city council speaker who proposed certain hotels in our district. You can assure us today that you do not have currently in the works additional hotels for regular shelter or asylum seekers to be opened in our district. Is that correct?
Well, currently at this time, I know I can speak to the emergency hotels. I do not know of an emergency shelter for this community at this time. But again, just to be transparent with, given the crisis that we are in, we know that can definitely change. So I would rather err on the side of being transparent with everyone that this is an ongoing crisis, but at this time we are looking for a more equitable distribution throughout the city. And at this time, I do not know of an emergency shelter for this neighborhood, but again, it depends on the amount of buses that we continue to get to New York City.
No, understood. But as I noted in the beginning, we're not questioning whether or not our city should accommodate the humanitarian crisis. We understand, we agree.
Mm-hmm.
But we already have a large shelter population to begin with, and we've had a lot of issues, and we're trying to work with Department of Homeless Services and to know well in advance of what happens in order to manage. So we don't have the drain on resources and institutions that have to support the needs. That's what we're trying to get to here, is that,
Mm-hmm.
like, just because we're welcoming doesn't mean you just don't figure out that there's 5 boroughs in the city of New York.
Yes.
I think.
Can you guys hear me?
Oh, Marika,
This is
perfect, Marika. Yes.
Hi.
Oh, great.
I'm still on the phone. But I just wanted to, because Haley was having trouble as well, I wanted to also be part of the conversation and sort of guide it a little bit regarding the sightings. Obviously, we started very early on. You were one of the early on first sites at Skyline that was opened in this emergency capacity, really pretty much being one of the sites that came online as we ran closely into figuring out that this was a real surge and a stretch in our capacity. So yes, I can definitely see that you guys got some red flags early on. In this particular community board as well. But as Haley has mentioned, there are 52 sites, one of which is in this community board. And I hope that's a flag for everyone that we are listening. We are hearing what your experiences have been. And the city has really sought to have this be a 5-borough solution. And so there, where you have seen numbers tick up under other emergency situations, I think that that number alone will indicate that we're not following that same pattern. And we've actually heard you very early on about your concerns about Skyline, about your concerns about the schools and the children coming from the shelters and the schools as enrollment ramped up. So we're definitely, we cannot guarantee where the next hotel will be. And I will be clear about that, because we have a mandate, a legal and moral mandate to house individuals as they come in. If we see another surge, and when I say surge, I mean we're at the point of getting between 5 and 10 buses of asylum seekers each day.
Coming to the Port Authority, we're very aware of it.
Yes, yeah. Also, I know you are, and so as you indicated, this is not about the asylum seekers, which I know we all want to support, but it speaks to the volume of folks that are coming in, and that we are morally obligated to take care of and house as we've done in this agency in days and years past. So we don't know where the next shelter is, but we're listening, and the numbers bear that out.
I'm going to go to committee members. I have two more questions. The first is, if by any possibility there is another shelter or hotel located, you will of course advise us in advance so we are not in the same position we were in with the Skyline. Is that correct?
I'm going to say to you, we will give you as much advance notice as we can possibly give you.
That's all we want.
Why am I saying that? We're opening up shelters at night, in the evenings. We know we don't have the number to bed folks. We have to open, and we don't have the lead time that you would normally get for a purpose-built site. So yes, as soon as we know, we are making informal phone calls and giving heads up, and then also written and more formal acknowledgements.
The last question, Marika, that we're going to our members. Recently, we got an inquiry that HRA and also you're opening other welcome centers, right? Not just this one. Is that possible, or is that not happening?
The welcome center.
Are you opening other welcome centers beyond
to the HERC?
Yes, beyond the Red Cross location. Are you seeking to open other welcome centers in other boroughs?
Well, okay, so some of those things are not within the DHS purview, DSS purview. The HERC centers, the Humanitarian Emergency Resource Center. I always forget one of the R's, but there are two R's in there. Those are not under the DSS umbrella. In fact, they are run by H&H and NICEM. And also the Welcome Center, the Red Cross Center is run by Red Cross with Moya leadership, if I'm not mistaken, but it's not DSS.
Thank you. Sabrina, and then Aurora.
Well, I have a few questions and comments, actually. I mean, Title 42 was invoked last the 12th, which is last Friday, federal government policy, which means that no longer migrants coming from Venezuela, which is the highest influx, are allowed into the country. They're being expelled back to Mexico. Title 42 is a policy that goes back to public health. That means that right now there is a new guidelines with like about 24,000 Venezuelans can apply online. They're not longer accepted at the border. This was the highest influx that we had. So I'm curious to know, I don't think we're gonna get more buses and more than just the one that already scheduled to come here, but the influx is done. Like the border is closed as of now. And actually I work for the city and I've been volunteering with the response of NICEM at the Welcoming Center in Port Authority. And our last shift to volunteers next week. So, and again, Title 42 is invoked. So I think right now we have to assume, as of today, based on the federal guidelines, that there are not going to be more buses, just the ones that are coming, the last remaining ones. But I think now we just have to look at like what we have here and build a response towards that. But they're not going to come any more buses.
Like, in other words, how to manage what we have today, because there's probably
correct. What we have is what we have. Until they don't, Title 42 is invoked. So until that doesn't change, and I don't see that happening anytime soon. Yeah, that's just the policy.
Thank you. Let's go to Roberta. I'm sorry, Aurora.
Sorry. So I was just asking because there was a very wonderfully drawn out go around way of just answering a yes or no question. Right now, at this moment, you do not have any in the works talking to about shelters currently. Is that correct?
In our district.
In our district. Is that correct?
I know that you'd like a yes or no answer, but
I just want to know. I want to know if that, but that is a yes or no answer. Like,
pardon me.
in the works
Ma'am?
right now? Do you have anything going on?
Pardon?
I'm feeling a little frustrated. I'm sorry. Yeah, you're definitely.
I can understand that, but I'd like to finish. The reason why I'm saying it is not a yes or no answer, I can tell you we don't have any, as my colleague has just stated very clearly, that we don't have any. And then tomorrow we might get 7 buses. And
Right.
there
That's all
might
I needed to know.
get buses
Just
more.
right now in
but-
this moment.
Ma'am, please, I'd like to finish.
Yeah, but Enrico, let me try to rephrase it. Not about the volume. Currently today, with our current position, is DHS or HRA negotiating with any hotel in our district? That's sort of the thing. And if the answer is yes, or it's no, it's fine, but just tell us that, because, you know, I know it can change tomorrow, but just today.
It can change tomorrow, and it could change within 24 hours less. I can't put myself in a position of saying something that I don't know of. I don't know of that. But again, with the change, and unfortunately, we get high turnaround, and then it may seem to others on the call that, oh, well, she might have known, or they might. I'm speaking to the overall larger picture, because I don't want to misrepresent something. You know, very often you can look at a small square in a mosaic and be very confused, and then you look at the larger picture and you understand that that's an answer that I can't give you tonight, unfortunately, but I can give you a bigger picture of what the scope looks like. And that's what I'm willing to do for you, as be as transparent and open and continue the dialogue.
We'll come back to this. Roberta, followed by Katie.
Thank you for being here. I wanted to ask specifically what DHS is doing to ensure that different providers are keeping up with the staffing needs of all of these new beds that they're opening. I know that there are already concerns around staffing, before this humanitarian crisis. And I just am curious what DHS is doing to ensure that staffing is maintained and that the safety of residents who are in those beds is being maintained.
Adequate staffing is definitely a priority for the DHS, and as we build out emergency sites, we're using DHS staff as well as contracted staff to build out the emergency sites. It is moving very, very quickly, and so we've had many adjustments around staff, but I thank you for that question, because we take it very seriously to make sure that everyone is properly brought the appropriate services. So when we have a site that stands up very quickly, it may start out with DHS staff, and then as the provider takes on the adequate amount of staff in order to intercede, then we move to that step where the provider steps in and has enough staff.
Yes, and to my point, in addition to that, a lot of the providers, and DHS has also been supporting this, have been hosting job fairs, and we've been also sharing the information with different constituencies, just so that they know there are job opportunities available as well, just to help with the staffing process as well.
Roberta, anything else?
It sounds like it's not going to be an issue, but are there any specific citing criteria for any new sites that you open temporarily?
All the sites that open, even on an emergency basis, have to meet the OTDA standards, which vary between families with children sites and single adult sites. I don't have in front of me, nor am I 100% familiar with all of those regulations, but they are. In fact, today we were at a site visit, and OTDA came in to do a site visit and really monitor that those regulations are being met on all sites. So it is the same standard as we move into the emergency sites that we use in our regularly purpose-built sites.
Marika, just for the public's information, OTDA, let them know what that means.
Office of Temporary Disability Assistance, the state organization which a state department, the New York State organization that oversees many of the regulations around sheltering and other services to our clients.
Thank you. Katie, followed by Hector.
Thanks. And I really appreciate you guys being here this evening. And we all know that with this humanitarian crisis, how busy you all are trying to figure out these issues. I had just two questions. One, I know that you said that there's only one shelter that's been cited in Community Board 4 to date out of the 52. But I know that there are several in Community Board 5 right near us, and that we're actually, the schools in our district are getting students from the shelters in Community Board 5, as well as the one located in Community Board 4. And so, and I know that there's a lot of work that's been done, which is great, so that there aren't, the number is no longer 38 per classroom. But I guess I'm just wondering, I know that the DOE had helped to have school specialists located in the shelters. I'm wondering what you anticipate doing with the students who are coming in right now. Are you arranging busing to other schools? Because I know that our schools are sort of filling up, or sort of how is that school, the numbers playing out?
If the class size cannot be accommodated, how are people being accommodated for classes, right?
Right.
So that question can be best answered by OE, but what we can say is that we always try to ensure that we work to enroll students in the schools that are closest to where their shelters are. But of course, when those schools meet capacity, then we'll go to the next closest school. So they would arrange whether it's travel for like older students, if it's a Metro card, or busing that is being coordinated, but the best response would be able to come from DOE.
Can you secure us that response so we understand what happened? Sorry, Maria, go ahead.
Sorry.
No, go ahead, Maria.
No, I didn't hear your question, but because unfortunately I was speaking, but I just wanted to add to what Haley was saying, which is that in addition, we're at the time where schools who have seen an influx of enrollment due to asylum seekers or shelters, or just an uptick, they have an opportunity to rejigger their budgets and then turn in whatever documentation they need to the Department of Education in order to get additional funding. So I know there are some concerns often about the number of students and whether there'll be Spanish language services or ESL services. Those things can be adjusted through the DOE budget. That's something the school will work with its superintendent to do, and I'm familiar with the process. We've been on several calls that indicated that this would be happening. So many of the schools' budgets that are requesting it. So I know you have close relationships with the principals, and they should be making those requests within the DOE.
Yeah, you're right. And I'm familiar with the process too about how they can apply for more funding. I just know with the same staffing issues you are dealing with, that trying to find the staffing quickly for the new students is hard. And so anyway, seems like it's a tricky situation to make sure that there's enough spots and enough staff to help with everybody. And just real quickly, one last question. I'd heard, but I've lost track. Maybe it's just a rumor at this point, that there had been an effort underway to possibly bring in a cruise ship to house people if that was needed. And I was just wondering if that's still a possibility, and where would it be docked? Would it be in our district?
I don't know where that is. It was definitely a part of the conversation when standing up the HERC system. especially in relationship to families with children. Again, that system is run by H&H and NISM. And so I don't think it is something that's being considered right now, but again, all bets are off, as they say, when it comes to upticks in numbers. If we continue to see upticks, then that might be something that H&H and NISM would be thinking about.
Thank you.
Thank you.
And I believe they said that.
Go ahead. Hector, followed by Josephine.
Hi, how you doing? Yeah, my question is I've been kind of helping out with the local schools with some of the asylum families. Some of the asylum families getting into the schools like PS11 and PS33, PS11 specifically. And there have been issues, unfortunately, unfortunately, PS11 and PS33 in schools in our districts have been very open to helping out the asylum seekers. But unfortunately, there have been other schools, I hate to call out Morton specifically, but that have not been helping out and registering the kids, even though it's been deemed that they're supposed to. So what is DHS and the powers that be to help out these families to make sure they don't run into these issues? I mean, we've had parents that volunteer that speak Spanish to go down to Morton and some other schools to help these families out because they're literally getting turned away.
So they just need help, basically. I got you.
Could you clarify the question a bit? Is the question about language access?
No, what he was saying, sorry, because I know he's breaking up. What he was saying is that there's kids that are getting turned away from schools, and what is DHS doing to help to ensure that kids actually have an opportunity to enroll in any school?
Yeah, you said kids are being turned away from school?
Yes.
Yeah, yes, they're being, the families have been turned away from the schools, Morton in particular.
So he mentioned Morton, and he mentioned PS33 and PS11 in Chelsea. And I think, again, this is a resource issue, right, Hector?
No, PS11 and PS33 have been very open and really stepped up to helping out these families. But then you've had schools such as, other schools, such as Morton, there's been issues. Registering for whatever reason that is. I mean, is DHS stepping up and informing these schools that is?
So I think I heard the question, and what I will say is DSS maintains a relationship with our sister agency DOE in relationship to all of our shelter systems. So we have a connection and a liaison, a DOE liaison that works with the shelter if we, as it opens up. So, for example, a shelter opens up, the Office of, I'm forgetting the acronym, but temporary housing students, where they're folks that liaison with the school, with the shelter, so they will come into the shelter and work with moms and dads in the shelter to register the students. And so I'm not quite understanding how they would.
Rika, I think we're bringing to your attention a very specific local issue at the school, not at the shelter, that you guys can look into. That at Morton, there's been a problem when families have gone there to register, they haven't been able to. That's what Hector is saying. Right, Hector?
Yeah, exactly. Yes, exactly.
Very local, very specific,
And for clarity,
send us just a note on that, because we would definitely want to share that information with our DE.
Right, if you can help us with that to get this to happen sooner.
Sure.
And just one last question. From what I've been hearing, and maybe this is incorrect, some of these kids are going to be they're being registered at these schools locally in Chelsea, but then the plan is the families are being told that they're going to be shortly moved to the Bronx. So I kind of find that interesting. Why are they registering in here locally in Chelsea? Well, we want to help them, but it seems like only a temporary fix, and then they're going to be shipped off to someone else. Where it's going to be kind of traumatic for the families and the kids to start over again in another borough.
Haley, can you speak to that?
That sounds like something that we should elevate to DOE. We're not really able to speak to why DOE would use that particular method, and I think it's fair to give them an opportunity to explain that.
No, I think the issue is that the families are going to be moved to the boroughs, so it's forcing the students to be transferred as well.
Yeah, I think that we have Nicola on the line. I think she was trying to chime in, and she oversees our Families with Children system, and I think she can add some context to what our process is and how we make the referrals and work hand in hand. I think I heard Nicola.
Yes, you did, Lilani. Yes, absolutely. So just a couple of pieces. We work closely with the DOE team. It's called Students in Temporary Housing. They're staff that's assigned to all the emergency shelters, as we have been doing for many, many years, including the regular shelters. If a child or children cannot get into a local school, DOE works with those parents to get them into a school. Thank you for flagging the Morton situation. I will definitely reach out to DOE in the morning to address that concern, because we were not aware of that. Specifically, if children are getting enrolled in school and getting moved with the intake location, those children are being stabilized, and we have to circle back with DOE to see what has been the conversations with those families in terms of the enrollment piece of school, to your point of the trauma of enrolling them and then moving them to a different community and then enrolling them back into school. So we could circle back with DOE and those pieces. But we have regular collaborations with DOE. We meet bi-weekly. We talk about school enrollment. Every week we check in with our shelters and provide updates to DOE on where there's enrollment needs are. They do enrollment on meeting with families on the weekends, holidays, you name it. They're doing it in terms of completing paperwork, providing the sessions in the preferred language. So it's a constant moving target, but know that everyone is trying to meet the needs of the families, and where there are concerns, we are ready to address them with the DOE staff, and we will bring this to their attention regarding the Martin School.
Nicole, we really thank you, because it's the kind of thing that these are the small local details that can help you fill in gaps.
Absolutely.
We know you're trying, but there's always going to be gaps back and forth, you know?
Absolutely.
Yeah. So Joe,
Thank you for your attention on this.
To that point, I would just ask to follow up, please. Like, if you can would be helpful to get the families' names so that we can reach out to Nicola and her team to try to resolve that.
We'll ask Jesse to follow up with Hector so we can get information for you.
I'll try to get some more info. Thank you.
Yadira, you're next, followed by Dolores.
I never got my question, but in my,
Oh, sorry, did I cut someone off?
No, go ahead, Yadira.
Okay. Good evening, everyone. I'm hearing, my question is regarding staff training and how people are ensuring that the asylum seekers and their families are all being treated with respect and dignity. I've heard some rumors about poor treatment. I've heard some rumors regarding staff collecting donations and taking what they want and not immediately giving it to the people in need. I hope that these rumors are incorrect. I just am curious about how staff is being trained and how you all are ensuring that staff is treating these people with respect and dignity.
Thank you for that question. I think we could defer to our colleagues at DHS to respond to that question.
So again, I echo the sentiments of Haley. This is first we're hearing about this. I'm saying it's surprising to hear the staff is taking donations, because the providers have been reaching out to DHS. We've been working internally with community partners to ensure the families are receiving donations. Many of the providers are seasoned providers, and they're ethical and have been doing this for many years and know the importance of getting donations and giving it directly to the families. what will possibly be helpful when you hear these kind of complaints is let us know where you're hearing them specifically in relation to what location. As it relates to training, providers have access to be able to train up their staff. We also offer trainings, virtual trainings too as well in terms of engagement, motivational interviewing, and a host of other trainings in terms of being sensitive, caring, and empathetic with the family. So in those instances where we're hearing that is not happening, please flag for us those specific locations so we can address that. DHS takes it very seriously, the care and the treatment of our families, and we do not tolerate disrespect in any form or stealing of donations for families.
So Dolores, followed by Leslie.
So first, I just would like to remark that, everybody recognizes the incredible amount of pressure that all of you are under trying to go ahead and manage the situation. But I just want to be on record that I'm very disappointed that all of these agencies have not learned from the lesson during the pandemic in this particular community. I'm hearing that you work hand in hand with some agencies. In case you did not know or you don't remember, the community board is a city agency. And this community board in particular is extremely welcoming, wants to solve for the problems. And if we can't get the communication right with a community board that actually wants to be involved, I can't imagine what issues that you are creating for yourself in communities that don't want any part of being part of the solution. So what I would ask of all of you is to think about, again, I know resources are stretched thin, but communication as well as planning and coordination with all of the resources, including the community board, can only be helpful. When we have, even if you don't have a yes or no answer as to whether or not something's in the works, if you happen to be talking to a particular location about the possibility of whether or not they may be suitable, it is appropriate to speak to the community board to ensure that, one, we can help coordinate with some of the issues that maybe the schools don't have the resources. Maybe NYPD is aware that there is going to be an influx of a different population coming in. The coordination is key. We're looking to try to make this work because, one, it's all of our problems, but two, it's in our community already. And we need to make it a comfortable community for everyone, whether that's someone that's here temporarily or whether it's those of us that have been here for over 53 years.
We're going to go to
Leslie. Community board. Thank you.
We're going to go to Leslie, and I want to just throw in one question, one item for you to think about. The community board has received multiple complaints from block associations regarding folks outside the Skyline, families late at night after 11:30. And it is just an issue that there are people who live up and down 10th Avenue. We ask you to look into it, that the proper recreation for kids is not after 11:30 on the sidewalk, playing, talking, when it's surrounded by buildings. So look into that as an operational issue, and maybe you need to help figure out where there can be recreational space for the families that is not on the sidewalk. It does not make for good neighbors. We've heard it from multiple block associations. Going to Leslie and then Josephine.
My question is quick, and it has to do with funding. One of the things that I heard recently is that some of these locations, the individuals were not given the proper tools, whether it was beds or clothing or whatever. Is there any monies, or are there monies coming from the federal government to assist the city in this effort? I know that the mayor talked about cutting the city budget, certain agencies, a few months ago. Has the budget been reestablished? And what about the federal money coming in to help in this regard?
Marika?
Yeah, I can't speak to the mayor's position on the budget, and certainly it's at the level where city agencies and the city hall are having conversations with our state partners and federal partners in order to see where there can be some financial assistance. I'm not a part of those conversations, so I'm not sure where they are with that, but you can rest assured that those conversations are being had.
Thank you. If you can seek to get information for us so we understand how this is going, we look to advocate and assist the city in this matter. Josephine.
If there's ever an opportunity that we can share information to increase advocacy, it will happen right away.
Thank you.
Hi, Marika. Thanks for just talking about our schools. I do have a question about laundry. I feel like I've been chasing this issue for 5 years, but some students are showing up at schools, and not from the Skyline. This is actually from a shelter in CB5, but as Katie mentioned earlier, many students from other Community Board 5 are going to our schools, and it doesn't really matter where they're from. The point is that they aren't getting enough laundry services where they are. So I'm trying to find out, does DHS have a system of laundry services for any person that's homeless in the city? And if so, what is that system? And if you could also just, specifically talk about kids as well, because they are going to school. We want kids to show up with confidence and not be stigmatized. So even if they're getting services once a week and something happens and they need extra services, what can families do? Thank you.
Thank you for that question. Indeed, it is important to make sure that our students are showing up to school, as you said, with confidence, and also with the ability to be amongst their peers and be to fit in amongst their peers. And in something specific as laundry, it will depend on the site in terms of whether they have on-site laundry services or whether there is a opportunity to go out into the community to some of the laundry services within the community. I'm going to just pause a bit, and maybe some of my DHS colleagues can speak about what families with children's operations would look like, and maybe even an overview of Skyline as well.
Marika, I didn't hear the last part. Can you say that again?
Yes, I was just asking if you could just give an overview of how you would manage laundering services, and then our Skyline partners may speak to Skyline specifically.
Well, one of the things we've been working with the providers is to assist the families with the local laundromats that are in the area. So if there's specific cases that we need to circle back on, we can do that. And it's being done with each shelter in terms of assisting the families with getting financial assistance to be able to go to the laundromats and wash. And I know DHS is also looking at other avenues of how we could address the increase in that need as we continue to open the shelters.
Maybe we can have Josephine refer to from which shelter the kids have come from on Board 5, and you can focus on that, because our goal here is to get specifics and
Correct.
Specifics. Okay. So Josephine, if you can send that through Jesse, we can get that to DHS. That'd be helpful. Other questions, Josephine?
No, that's it.
Jessica, followed by Sabrina.
Thank you. I wanted to raise a separate issue, which is that I know some of the food pantries in our area have been really overwhelmed. During the pandemic, we saw a tremendous increase around the emergency food system, which frankly is a good thing that people are turning to this as a resource. And thankfully, for much of 2020 and 2021, there were enough resources there from the city and otherwise to be able to support everyone who showed up at food pantries. Much of that funding has gone away for various reasons. I fully understand that. But our pantries that are in neighboring, in our district are really suffering now because they're seeing a whole new influx of people, aside from all the numbers of people they were seeing previously who continue to rely on them. And they report, again, places like Holy Apostles report very significant numbers of asylum seekers showing up, some coming directly from Port Authority, but some having spent time in the district. And I don't know, but my sense is that there's not necessarily coordination, and there's certainly not a shared commitment necessarily to advocating for more funding for places like that so that they have enough resources to meet the needs of the asylees in particular that they're seeing. And I just want to be sure that's on your radar and also get a better understanding. Maria and I did a tour of the Skyline. We saw the meals. They reported that they were not culturally relevant, and a lot of people stopped taking them because they didn't meet their food needs. So can you speak about how you think about meeting the food needs of everybody who's coming in, and how you rely on the broader network to partner with you to do that?
So one of the things that is wonderfully unique about DSS is that it encompasses DHS and also HRA services, which also are part of pantry services that you're speaking of. And one of the things that we were able to communicate is this anecdotal conversation that you've had and others have shared with us. And we've done a comprehensive survey into pantries to do just as you had suggested, to make sure that they are adequately serviced with pantry items, shelf staples, and the like, so that what we're seeing is, yes, folks are using the pantries, but they are not exhausting the pantries. And what I mean is that they're not, they haven't dwindled down to not being able to have services for everyone. So you should know that we're actively looking at that. We've got our thumb on the pulse there, looking at food services, and as I said, going in, making talking to pantries, doing surveys, comprehensive surveys of the pantries, and meeting whatever needs that they have. We haven't seen a significant uptick, even though we still get anecdotal evidence that pantries are being used. So that means that as we are stretching, we're still meeting the needs of the folks that are additionally online for services around food.
I think we're going to get you information about the pantries in our district, specifically what they said to us, for you to assist them to the degree that we need to plug this new need. So like the healthcare center, like the schools and the food pantries, they're going to need more assistance. And we'll get you, again, the very local things here, because we know you're trying to do this on a citywide basis. We're trying to give you the local information. But Jessica, something else?
I would just say that I'm very happy to hear you're looking into this, and I'm shocked because the pantries that I work with, including the network I run, we're getting inundated with requests and we are turning people away. So I just don't think that those facts bear out, and hopefully we can get you that information so you can reassess the situation.
Yeah, please.
And by the way, that's a wonderfully lovely way of saying that, no, you're wrong and we know about it. So we're going to get you the information so you can help fix it. Okay. Let's go.
Well, I don't mind being wrong.
I know.
I don't like to do it very long. So you corrected me. Please share that information with me, and we'll both be on the right side of this.
Thank you. Sabrina, then Maria.
Yeah, maybe I can answer Leslie's question, since I work for OMB and this is public records, but I can attest that, yes, the city is doing 3% savings across all agencies, and that is before the influx of the asylum seekers and the humanitarian crisis that we're living right now. This has to do with budget gaps that we have. They are, though, realigning needs towards the asylum seekers. So the new needs or the new asks that agencies might have are heavily focused on asylum seekers and education, I believe. That said, I do think there's a conversation, or at least because I don't know what's the process of the federal government involvement, or how would it be to ask for federal money. I think it's something that it definitely, I think the city of New York already asked, but I don't know what's the steps or what is going on.
It comes through FEMA, and that's how it's applied at the border. So we're asking specifically
to the FEMA. So the request for us is to FEMA. Okay, so I guess we can follow up when we have a letter or something with FEMA in regards separate from the city money.
Maria. Thank you.
Thanks. Thank you, Joe. Hi, Marika. I'm Maria Ortiz, the co-chair of Housing, Health, and Human Services. Thank you for being here. I have a number of questions. And first, I guess I would start with, specifically, I'm wondering about the Skyline. How many families there? My understanding is there's over 200 families. And I'm curious how many are asylum seekers and how many are not.
How many are from the general shelter population?
I'm gonna ask for our Skyline folks to see if they're on and can be responsive to this one. Just as they unmute themselves and prepare to answer, the crisis, of course, as we open up shelters, is you should also understand that that the shelter has asylum seekers and folks of the same day that came in potentially looking for shelter. So it may not have a 100% asylum seekers there, which is evident in your question. But do we have those numbers available?
Can that come from Freddie? Yeah.
Yeah, how you doing? Thank you, Joe. Yes, absolutely. The Skyline actually has 232 units in which we're currently housing approximately 189 families. We have the ability to house a maximum of 209, but sometimes families occupy multiple units or have vacancies. And so our current census right now is 189 families residing at Skyline.
And how many are general shelter population versus asylum seekers?
Our asylum seekers are slightly over 50% at that particular location.
Over 50. Thank you. I have some other questions for you, Freddie, but not in a second. Let me just go back to Marika. Marika, so I heard earlier someone from DHS, I believe it was, who mentioned in CB4, we have one shelter site. And in CB5, do you know how many we have?
We have 3. Well, obviously separate conversation for CB5, but CB5 has three emergency hotels that we've opened up.
I thought we had 4. The Hotel 46.
CB5.
Right. No, in CB5, I thought we had the
3.
Okay, I have the Hotel 46 at 129 West 46, the Night Hotel 132 West 46. Tell me when I'm wrong. The Row 700 8th Avenue, and then the.
I don't want to. I'm sorry, Joe. I don't want to call out addresses and locations, but.
These are
Leilani. I'll just add. I'm sorry.
Yeah,
sorry, the road does not fall under DHS. The road's not a DHS site.
Okay, so I want to say one thing. Addresses, when they're printed in the paper, are no longer.
I get it.
They're public information. We can't hide behind that. So
I get it, but I just have to reiterate it.
And I think it's appropriate that it's fair that even if something is put out in a public manner, that we not be a part of perpetuating a abuse of social service law. And we
oh my God, guys, you're living in the world we live in. We walk by this, we know it, we live with it. We need to stop being so dogmatic. And we're asking if there are 4 additional shelters.
Or 3. No,
okay.
There's 3.
3.
Correct. Thank you.
And just out of curiosity, does anyone at DHS know the proximity of these sites to one another?
Are we speaking about Community Board 4?
We know
5.
4 and 5.
Yeah.
4 and 5.
Like the Row is up on the other side of 8th Avenue. We know
Yeah.
that, but adjacent to what else? We're trying to understand.
Yeah. Well, the Row is not operated by DHS. But
But I feel like there's an opportunity that perhaps we don't know the answer to that question, but obviously you do. So we'll concede that we don't know and you do.
No. Honestly, what I really want to say here is I know everyone works in certain agencies, but from a community point of view, it's all one place. So it would be helpful as we go forward with this, maybe in a future meeting where we have more than one agency, so we get the full picture, because we need to understand it. We are the public, and we're asking you to respond to the public. That's all. Okay. So it's really important that we're on the same page and we're not being snarky whatsoever. We're trying to understand what the hell's going on because it's happening so fast. You know, I'm a New Yorker talking to another New Yorker to get information. And it is very frustrating, like Aurora said. That's all. Maria, take it from
I
here.
think where I was going, I'm sorry, Marika, where I was going really with I know Joe is trying to clarify, he made it sound good. Being clearer, I think what I was trying really to get at is something someone else said. Dolores mentioned it about collaboration and collaborating with the community board. I asked that question because I know that not everyone really at DHS knows unless you live in the community. And those on the community board live in the community. And we are willing to help and assist, right? And we do care, right? And this is the committee you come to if you want to know things about social services in the community and where it's a good place to cite something and work collaboratively. And I have another question. I did hear Freddie say that over 50% of the asylum seat, there's over 50% at the Skyline, but I was actually told at a different time it's over 90. So I would like clarity about that.
You were told that. Yeah, Freddie, go ahead.
So thank you so much. So I actually don't have the historical data in front of me as far as particular timeframes. What I can say is that the population does frequently change in our programs.
Yes, absolutely.
Clients are transferred, moved around. All of our programs. So the programs that we're operating were not opened under the emergency sanctuary solicitation. And so these sites are not slated to be solely for sanctuaries, asylum seeking clients. And therefore there is a mixture. And so some clients have been moved on, some clients have been transferred. I can say for a fact, 100% that we do have less asylum seekers right now than we did when we first opened the Skyline, but I don't have the actual statistical data in front of me as to at what point it was over or crossed below 90%.
Okay, thank you for the clarification. I appreciate that.
No problem.
Another question I have is today, I walked by the Skyline this afternoon. I saw Linda Rosenthal, New York State Assembly member Linda Rosenthal's staff outside and asked to see the playroom, not permitted to. And I know that this is the second time Linda Rosenthal showed up at the Skyline. The first time there was a delay in being able to see the site. Today, not permitted to go in at all, but can return tomorrow. And I'm curious if that is something that you all are aware of, and what is the rule around that? Is that DHS has to give permission, or is it that the heads at Acacia have to give permission? I would like clarity on that.
Yes. So yes, I am familiar with that. On both occasions, I spoke with Assemblymember Rosenthal, and then today with her staff, who generously made a donation.
Yes.
And then wanted to, was seeking to take a picture. And it is appropriate that, and everyone at that, and especially within that office, is familiar with our protocol around visits, to site visits. And it's really in order to protect the population, which is, as we know, very vulnerable. In this case, we want to make sure that the asylum seeker population is taken into account as well. So the coming to the site at a time that hasn't been designated can facilitate a wait, which happened the first time. And the second time today, there was a ask to donate and then take photographs, which is prohibited, again, under those social service laws previously discussed on this call. So without saying very much more, those are the parameters around those two conversations. And I would dare say that the office as a whole, both the assembly member and her staff person, I think may also be on this call. Maybe I'm not sure. I thought I heard.
Yes.
I think that they are. I think they were satisfied with the conversation we had on both occasions. It may and otherwise if they're not, we can continue to have those conversations. So I hope that answers your question.
Let's go to Yadira and then Erica Overton from Assemblymember Rosenthal's office.
Joe, I didn't finish.
I'm sorry.
Sorry, Maria.
I'm going to come right back to you. I think Yadira's got to pick up on this.
Okay.
Thank
you.
Sorry, I promise this is on you, Maria, too. So I personally connected some staff with Kidville, which is was an indoor play space that shut down just a block away from the Skyline. This was back in August, I think. And my question is, has the playroom been completed, or is it a legal issue with, protecting the clients?
Can we just ask Freddie to answer that, because you would know the most?
Yeah, absolutely. I'm not sure what legal issue you might be speaking of. We have no barrier to utilizing the space. I know we did receive the stuff. I actually arrived a few days after and was overjoyed at the amount of stuff that we saw in that space. What I will say is that the space is a multi-purpose space, and it's not solely utilized for a play area. We actually use it to do movie nights. We do recreational activities. We have one of our affiliates, Lower East Side, located in the Lower East Side, and provides creative arts workshops for the children. That comes 4 days a week and does creative arts workshops with them from 3 to 5:30. So the toys are put out, they are moved. Depending on what time you show up throughout the day, you might see it looking like a huge playroom, or you might see it set up for a movie, or you might see it set up for a game night and things of that sort. And so we do kind of shift that purpose a lot, but the room is active. It is being utilized by our clients. They are very much enjoying it. And we have some wonderful stories about our Lower East Side project, bringing the arts and creative arts workshops in there.
So therefore, if this question came up about a photo and it was not a photo, just a visit, there would be no barrier to the assembly member showing up and visiting the facility as an elected official. Is that correct, Freddie? Freddie?
I think that's more for IG, but no, that's so basically I would say, that's for Leilani, but I would say that Acacia is proud of the work that we do and we're happy to show it off. We just have regulations we have to follow. And so it has to be authorized by DSS. And so whether it's a visit or a photo,
any visits by no, forget the photos. Yeah. Any visits by an elected official had to be cleared through DHS?
Correct. And so the first time when there was a wait, what happened was we got word they were there. We called Intergovernmental Affairs at DSS immediately. We told them we had an elected official that was there and would like to come into the building. And they made it happen, but it usually takes that period of time. And so in order to stay in compliance with our regulatory agencies, we will have to make those calls and get approval, which is why we can be coordinated in advance. That would be really great to prevent any frustration on your part or anybody visiting. But we love the work that we do. We're really excited about it, and we love to show it off every opportunity we get. And so as long as approved by DHS, we welcome everyone to come tour, visit, and see our program.
I'm going to go to Erica, and the answer's kind of sketchy. Go ahead, Erica. Sorry, not going to buy that.
Hi, everyone. Erica Overton, Assemblymember Linda Rosenthal's office, her chief of staff now. I do just want to clarify, and I don't really need to rehash the first visit because it went fine afterward. There was, and just, since it's been brought up, but yes, it took the assembly member and I showed up with Ryan Health because we wanted to connect them after Ryan Health had been trying to get in touch with the shelter to offer medical services and whatnot. And we went with them to the shelter. It wasn't an unannounced visit. Yes, it took us a while to get on. And just to clarify, the assembly member did call Commissioner Jenkins, and Commissioner Jenkins did get us into the shelter. We had a wonderful conversation after that. But yes, that was that was the first. And just so, yes, that happened today. And I just want to clarify, it's not about the picture. We dropped off 3 carloads. First, the assembly member in early October, we talked to PS 51, to PS 111, and also we had our conversation with the Skyline, and they showed us the community room and the area, and we wanted to provide that space for children to really enjoy that area and to be outfitted with toys and to feel at home and have a space to be so that they could play and it's not on the street and whatever. And that is what the Skyline wants to do as well. And so we had a donation drive, and I am sitting in the office. I am surrounded by just bags because hundreds of West Siders have donated. I am sorting still tonight once I get off this call of clothing and everything else, have been extremely generous, and hundreds of people have come to donate and wanted to help somehow and did not know how to help anybody. And so that's why we had this. And so we will be having 2 events with PS51 and 111 to give away hundreds of coats and clothes and everything else. And so today we dropped off 3 carloads worth of toys to the Skyline, just so all I asked was just, I wanted to see it when it went up to the conference room to make sure that A, it was there, and then B, that to show people what they were able to do as a community for the Skyline. And so they have given, I mean, I can't tell you, everybody who comes into this office, one woman cried today by the sheer amount of things that were in this office. I can't move in this office. I wish I could even move my screen. It's walls of coats, and that is surrounding me. And so all I wanted to do was show people with the Skyline, because I believe we have a collaborative relationship now, is just that, look what we did as a community for people who really needed it. And that was it. And so Marika, thank you. She did come to she helped me, and we will go there. But that was the point. And it was fun when we were bringing the toys in of kids who were walking in that got excited by it. And that's it. That's all we want to do, is provide this space to the kids. And we will have an event with PS51 and 111, and we're in constant contact with their principals of what is needed. And so we will have that event on next week and the week after to give out all of this stuff. And then right after, we went to Ryan Health and gave them, I have thousands of diapers now, and we gave them a lot of diapers today, and cloths and formula. And so I think it was maybe a little bit today, obviously, was maybe frustrating, but that's all we wanted to do.
Eric, if I may, also, this is Haley. I just want to say that we're definitely grateful and extremely gracious. It's amazing that the community is doing this for the shelter. I just wanted to reiterate, we definitely this process is definitely not to deter anyone. This process is just, again, the shelter folks live in there. There's, we're protecting our clients. It's really just to coordinate. So we definitely want to help. No, I'm sorry. It's definitely just to help coordinate. So it'll be easier for you to go in once you coordinate with IGA. We'll make it happen right away. We'll help to coordinate everything, whether it's donations, visits. So it's definitely not to deter. It's definitely not to be another layer, but it's really just to help the coordination aspect of it.
Haley,
so we're definitely thankful.
And I
want to note that saying going through intergovernmental is another layer. These are our elected officials. They should be able to establish relationships with the provider directly and not have to worry about DHS. If the provider is okay with dealing with this, they're fully aware of all your regulations, it really feels like another layer, okay? And let's move on back to Maria and let this go. Maria, go ahead.
My other question was going to be about staffing that's at the Skyline. I do understand that initially, back in June when you opened up, it was an influx, it was an emergency. We're in October now, and I'm curious, what is staffing like there? Do you still have positions that you need to fill? And particularly, I'm curious specifically about social services staff and security staff, if there are positions that you need to fill. Also, plug for CB4, you can put positions that you're looking for, jobs available on the CB4 website.
And I want to set the stage here. We all know it's an emergency, no matter what it is, whether it's opening travel in for the specific social service needy single individuals or this at the Skyline. However, the world we're in has a huge labor shortage. All of us who work in various kinds of organizations, no matter what it is, have a hard time hiring people. We know for a fact, when this was opened so quickly, Acacia pulled staff members from other locations to temporarily staff the Skyline and travel in. We know why you did it. We understand. It's just thrust upon you. But now we're moving into operational level. Are you actually able to secure the staff that you need as opposed to just borrowing? We know this is hard. We're not like born yesterday with it. So we really turn to Freddie again to answer this issue and be honest with us. If you have 10 positions open, you have 10 positions open, whatever it is, you let us know what's happening here. Thank you. Go ahead, Freddie.
Absolutely. Thank you, Joe. Yes, so you are correct. We did open this shelter very quickly and had to borrow staff from other locations to operate that. I'm happy to say that we have gotten a place to where all those borrowed staff have been able to return, and the staff operating Skyline are actually Skyline staff. We obviously know there's a work shortage, Acacia has really worked to kind of recruit staffing for all the programs that we've opened. We've actually had 3 job fairs in the last month and a half that have allowed us to hire almost 200 individuals to work in our programs. And so we're really excited about those outcomes, and it's really challenging times. We've even expanded and partnered outside of the 5 boroughs with other communities to help us bring in staff. And so we've been very successful with doing so. We still do have deficiencies. We are very transparent about those as we work through them. Honesty is important, and that's how Acacia likes to lead. And I believe we actually currently have 8 social service vacancies at Skyline Hotel. China, if I'm wrong, you can.
How about a travel in?
55.
Did you say 5 or 55? Please tell me.
She said, no, she didn't say 55. That's China, and she's speaking for Skyline. That's because she's counting, I added in housing staff. That's why my number was higher than hers. So she's missing 5 social service staff. For me, permanent housing is a piece of that. And so I added in the housing staff also as well. And so that's why she said 5, I said 8, because I was counting the 3 housing specialist vacancies that we still have.
Among the 2 sites, you still.
No, that's solely Skyline so far.
How about a travel in? How many are open? Because again, we're realistic. Just how many are open there though at travel in?
Camilla, Stephanie, you want to help me with that one?
There are 2 case manager vacancies and 1 housing specialist vacancy, so 3 total.
3. And we know, by the way, that all of us struggle every single month on trying to fill the next position. And then people get hired, and I'm pretty sure people get hired and people leave because there's a lot of shopping around for jobs right now. So you're doing much better than you were when you opened them, and we really appreciate that. Maria, is that a good, solid answer for this?
Thank you so much. It is. And I just want to say I appreciate you guys, especially at the Skyline China. You are doing good work, and I know it's hard, but keep doing it.
Thank you so much. We appreciate that acknowledgement. We've gotten a lot of attention, people to come out and visit, and just want to remind everybody that, you know, our staff is working really, really hard. They've committed their lives to finding resources and helping these people. And so when you come by and you do make a visit, make sure you thank the staff in person. That'll be really great. We really, really appreciate that.
All right, if I come visit, can I get in, Freddie? Can I get in?
Or must we call InterGov in order to get cleared?
I love.
Let's plan it.
Somebody from
organize
DHS
it. So I
should
would love
smile when I
staff.
say that. Leilani should be smiling. We're colleagues. We're
Yeah,
calling
you all
out.
have my email. Just shoot me an email. I'll schedule it.
No, we're calling you out on the crazy part. If you want us to be neighbors, we have to establish relationships, not go through 17 levels of government.
Yeah,
okay?
Unfortunately.
It's just
only
me.
one
It's just one
level.
level.
No. Not buying. So, Maria, go ahead.
I'm done. That was my last.
Okay, so we do
we-
need to understand.
Oh, we do have a hand in the public, Katie
Yes,
Savage.
yes, we do. Yes, before I go to Katie, I want to first of all thank Acacia for providing the list, the checklist answers, right? And we've been reviewing them. We're going to write back to you to get more clarification on things. But I think that you actually took it down, wrote it through. It helps us deal with this. And I want to say going forward to DHS, this is why we put this checklist together. It helps us get more educated to answer better questions and understand how this can be managed in our community. So let's go to travel in for a moment and talk to us a little bit about why the population came here. We understand this is they've been moved around a lot. It's reasonable accommodation. There's much more social service needy clients at that location. We got a lot of community complaints about folks going into people's apartment buildings, problems with like doormen, people on the street. What are the issues that you are facing there, and how can we directly work with you to get that managed better so it creates less issue in the community? Stephanie, is that correct?
Yeah, thank you. That was a multi-part question. The first part was about arrival. DHS, you want me to take that, or about the population, or do you want to go? I'm good either way. I just want to.
I'm asking you, the operator.
Okay. Well, no, the first part of the question was how did they end up getting there? And sometimes
yes.
Like to answer
well, you would
those
probably
questions.
know that though.
Yeah, so I got you, Joe. I'm going to answer that for you, right? So the population at that location became a COVID isolation site during the pandemic. After the pandemic began to slow, the city began to empty those isolation sites and seek alternate methods. What we saw, and I'm speaking for myself, not necessarily for DHS, what we saw was that during COVID, we taught clients how to utilize the reasonable accommodation program to actually receive special regulations or special accommodations for whatever their medical needs may be. Word spread very quickly, and the clients became very self-advocates and began to significantly fill a large number of reasonable accommodation programs. Part of these are reasonable accommodations is they get to submit a request like you would at your employer. I have a reasonable accommodation. I need a special kind of screen, a special chair. And so for some reason, it was determined that these individuals required to be in a single room by themselves. And so this location was utilized for that purpose. Individuals who provider wrote a note stating that and provided supporting documents, this individual, for whatever reason, due to their ailment, would be better suited residing in an individual solo room. And so everybody at Travel Inn has their own unit right now, and that is the reasonable accommodation that has been provided to this population based on whatever their ailment may be.
So
does that answer that first part of that question for you? Before I go on?
Yes, but very specifically, higher level social service needs, and therefore a lot of persistent mental illness and resultant problems from the surrounding blocks. So speak to that.
Okay. I mean, I'd have to look at the population again to see if it is a high volume of mental health. We do have some. I don't know it to be a large volume. I think the majority of the individuals there are there for medical ailments. But in regards to the site itself, I see Camilla nodding her head, who's actually the director of the location. But in regards to the issues at that program, I know that you cited a few concerns. I think these concerns were cited in previous meetings. I think we took initiative after that and took some actions along with the community to really resolve this. We went around to the community, introducing ourselves, sharing cards, sharing information. We gave out the phone number to the local, directly to the shop, so we can call for immediate issues. We also developed an email address to share with the community to voice any concerns. And we extended our patrols to have the security doing external patrols actually up and down the block. So now when they come out the building, they actually patrol from the corner of 10th. They walk up to the corner of 11th. They do not turn any of those corners, but they walk the complete block to ensure none of our clients are congregating. And I think I'm very happy to say that we've seen that there has been a significant decrease in any loitering. We haven't really had any complaints. We checked the email box as of today before the meeting and saw no recent issues anytime soon. And so if you do, we're welcome to partner with you and try to find solutions. But we think that there has been significant progress. I hope that the complaints are old complaints, but we're available to address anything new that may come up along the way and address it quickly and immediately.
And Camilla, as you know, it's not the majority of people, it's the 1 or 2 or 3 that cause the most problems sometimes because they just have a lot of social service issues. So
absolutely. And that's why I think that's why we gave this communication, because one thing is that DHS has been very supportive in removing clients who don't fit our program, our model, and respect our good neighbor policies. And so if community members do come forward and share information that can be attributed to a particular client, I'm confident that DHS will support us in removing that client and putting them in a place where it may be more suitable for them and not have drastic impact on the community.
We'll follow up with you directly on the various complaints the board has received and get them to you so you're aware of them and we can go through them one by one. Okay.
Thank you.
DHS, is this location, how long will Travel Inn be in operation? Any, I mean, I'm not asking that like as a setup, just sort of general idea what the thought is, you know, what's the general thought?
Hi, this is Cindy Tita, Assistant Commissioner. We don't have a timeline as to when we would be out of that facility. Right now, it does accommodate those gentlemen there that require a single room.
Right.
Should that change, we will notify you.
Right. So we did ask in July 29th when these things were, when these 2 locations were cited without notice, and you did say you would get some idea back to us on the duration of these. So we're going to ask you again, so we don't get the frustration from the public or the members, to think about this broadly, so we understand the nature of this location and also the Skyline. Again, because of our concentration issues, not the question of whether they should or should not exist. We understand that fully.
Absolutely understand. I wasn't present for the last meeting. I was actually out of the country, but I will circle back with my colleagues.
Thank you so much.
You're welcome.
Was there, I'm sorry, it was Cindy, was there a response to that related to the Skyline? Or?
No,
that was the Travel Inn.
Cindy's single. She does singles, right? That's that you're on the singles.
I'm singles, yes,
Right.
Travel Inn.
Yeah.
Thank you for clarifying.
Yeah.
No worries.
Do we know about the Skyline
So that goes
in the
to
time frame?
that goes to Leilani, I guess. We don't, do we have any further time frame thought?
For emergency hotels, we don't have a timeline. But I do know that this is, the administration has an overall goal. But with this new emergency, unprecedented humanitarian crisis, there's no telling on a timeline. But I know that overall, and Haley and Marika, please correct me if I'm wrong, but overall there is a vision and goal to still continue to ultimately at some point get out of commercial hotels.
Right. And that is correct. That is correct.
Okay.
Yeah. We all share that same thing, because hotels are not the place to have people. We understand that.
We share that sentiment.
Yeah. We'd like any other committee members. We have, I think, one member of the public who has been very patient. Ask a question.
Katie Savage. I thought I brought her.
I'm here.
Oh, you are. There you are, Katie.
Thank you.
Perfect.
I'm honestly shocked. I'm the only member of the public who is here to speak. My name is Katie Savage. I was recently named co-chair of HK 4954 Block Alliance with Steve Belita. The Skyline is 2 blocks away from where I live. And we were initially, all of this has just been a mess. I hadn't gone to community boards prior to the pandemic. When the pandemic happened and everything went online, I was able to start attending more of these and learn more about what's going on in the community. And I have to say, it makes me incredibly discouraged and unsure of who is in charge of who. I feel like we're in a plane that has no pilot, and autopilot is about to stop working and we're going to crash, because it's insane to me how we ask simple questions and it's like, no, that's another agency. Oh, that's a different agency. Oh, that's this. I know the Roe and the Watson have also been talked about as being some sort of shelter. I don't care if it's a shelter for asylum seekers, it's a shelter for homeless individuals that are already in the system. It's a shelter. If it's a hotel that's going to be used to put people that are living in, it's something we should know about, and we shouldn't have to ask 500 different agencies the answer for that. And also, I'm concerned with the Skyline, the fact that you have, families that are living in rooms that don't have any way to cook meals. They don't have any way to refrigerate anything. They're basically stuck to the schedule of the shelter and when they provide food. And, that's not an ideal situation. I know this is an emergency situation. And I don't know how a food pantry plays out unless they're actually cooking meals, because getting dry goods and other stuff, if you don't have a way to cook it, it serves no purpose. So I don't really know where I'm going with this. I just want to say that as an average citizen of New York City, this is incredibly frustrating. And I also, all the board members you see on this screen are not paid. They are volunteers. They are putting their time and their effort into trying to make this work, trying to make city government work for the community. I don't understand how the city relies so heavily on community work, unpaid community work, to run stuff. And then even when we try to offer our advice and our help, we just get disregarded and shut down. But clearly, it doesn't seem like the city knows what they're doing. Because, you put shelters next to each other, you don't properly place things, you don't know anything else that's going on in the neighborhood, but we live here. We walk by it every day. We see it. We have had so many shelters moved in here. And I didn't even realize that prior to the pandemic, we already had a huge amount of social service providers in this area. So it's oversaturated, and it's very frustrating to be told that we need to be welcoming and we need to understand it's an emergency. Where's the understanding for the community? Where's the understanding for the people who are afraid to leave their apartments at night? Where's the understanding for people who see syringes on the street? Where's the understanding for the schools that have too many people, too many kids in them? It needs to go both ways. And I just wish, it's comical to watch these meetings, because it makes you wonder who is in charge. Where is the adult? I don't feel like there's any actual plan. It's just a lot of, well, I can't answer that. I'm not sure. You have to ask this person. And if we're going to have these meetings, it's a waste of everybody's time to not have these answers and not be able to answer it. So thank you. That is all.
And we don't need a response to that. We really thank you, Katie, for just voicing the frustration of people who live here every day. I want to note just for DHS and Acacia, we have representatives tonight at our meeting from the West 44th Street Better Block Association, from the West 47th, 48th Street Block Association, from the West 36th Street Block Association, from the 4951 Block Association, and from the West and the West 55th Street Block Association. So people are listening, trying to understand, and are here for a reason. We'll go to Michael Harachi, and then
and I brought Christine Gorman over.
And then-
So
and then
Christine, you can
Christine.
go first, and then Michael can go next.
Yeah.
Thank you, and thank you to everyone for all that you do. My question is very specific. I think it was Haley Nolasco who spoke about 52 emergency shelters were cited since May across New York City. I understand the sensitivity about giving out addresses, but can you give us an idea of how many in each, I don't know, community board or whatever, so that we could get a sense of the breadth across the 5 boroughs? It would help me and others to understand how this is siting across the whole city. We've tried this with a group I'm involved with, looking at Hell's Kitchen, but it would be helpful to know across the city. So is there a map or some way that you could tell us of those 52 emergency shelters, where, not specifically where, not addresses, but per community board or council district or whatever it is you want to say?
Yes,
Can
thank you so
you,
much. Yes, Marika.
Yeah, so over at the borough level, do you have that information in front of you? If not, we can certainly make sure we get back to.
Yeah, and it can be simple as, community board 1, X numbers, community board 2, Y numbers, nothing more than that. So we understand the distribution and how we're all managing this together.
Yes.
Thank you.
Happy to do so.
Yeah. Michael Harachi, are you over? Michael, we can't. Are you? Try to say something, Michael. We're getting a very bad signal. You sound like a
chipmunk.
Like a chipmunk, yeah. We're not getting your voice. I mean that. Like, if we cannot, we're getting like a squeak.
No, not working.
It's a total squeak. Maybe you can step out and come back in again, and we'll bring you over, okay? Because the connection is terrible. Just like to shake your head if you heard that. Okay. I saw before that we had Sean Coughlin from the council member's office who wanted to speak. Sean, do you still want to speak?
Yes.
Sean, raise his hand. Yes, bring him over, please.
I'll do it. All right.
And remember, we have 2 more items, guys, so we got to close up on this soon.
Thanks, Joe. It was a while ago, but I just wanted to echo your clarification that those sites that were proposed in Community Board 4 for temporary hotels did come from City Council leadership, and that our office found out about them at the same time that you all did.
In the press release, right?
Correct.
Okay. Thank you so much. We'll try to see if we can get Michael back in, and I really want to sum up on this.
I do have a question. I don't know who can answer it, if it's Acacia or DHS, about something Katie mentioned, the refrigerators in the rooms at the Skyline. I can't recall if in the past there were for the other shelter sites, but I'm curious if that's something that, or Freddie, I don't know who can answer.
Yeah, that's an
Yeah.
Acacia question.
Thank you. No problem. We can take that one. Yeah, so regarding the Skyline, so our standard policy in hotels, as you guys know, are very limited space. And so we try to keep the items limited as possible in the room. So our initial policy is that in a family with children site, anybody with a child under the age of 2, or with some kind of medical ailment or requiring refrigeration for medication, will automatically receive a mini refrigerator in their unit. However, not for other shelters, but for Skyline in particularly, we have been drastically increasing the number of fridges that we're giving out. And so we have expanded beyond that. And we are actually partnering with the landlord, and he's in the process of purchasing mini fridges for every unit in the building. And so they will all have one in the next couple of weeks.
Thank you so much. That is very good news.
Thank you.
Thank you.
Michael Hirachi, we're going to try you again.
Can you hear me?
Oh my God, yes, we can. Yes.
Oh, right. So I do support more shelters. I missed a lot of this meeting, so my apologies. I did get little tidbits here and there. I appreciate all the work that everybody is doing to address not only the humanitarian crisis, right, but the human rights violation that our culture, our society, and our country has contributed to. I do support more shelters, more services, more supportive housing with complete wraparound services. I really appreciate seeing the Skyline turned into a facility to serve this community. I appreciate on a separate note, but on the same token, I appreciate the new construction of the Covenant House. I wish we had more robust leadership in regards to addressing the homeless, the people experiencing homelessness in the area, who are, many of them are from minority communities, many of them with combining comorbidities such as mental health conditions. When we talk about being offended by the sight of syringes on the street or the sight of a person without a home, we have to remember that these folks are human beings, right? There are brothers, there are sisters, there are aunts, there are uncles, and they deserve compassion and housing, healthcare, education, and nutrition, just like the rest of us do. I think it's useful to think about the history of our city with some of the highest income disparity in the nation. And we don't blink an eye at spending $11 billion on a department and on a national scope. We're adding 11 or 12,000 more police officers that cost a lot of money, but we can't seem to come together and find creative solutions to address the issues of people living on the streets and people without bathrooms, people without food and nutrition. And I thank you all for your contributions and your work on these efforts. They do not go unseen. So thank you.
Thank you, Michael.
Thank you.
Let's go to, just to sum up on this, first of all, DHS, thank you very much for enduring another meeting with Manhattan Community Board 4. We really appreciate it. And we appreciate your good humor and your information and trying to get us information. So you have stated that you will get answers to our questions that we submitted in July. Leilani, can you give me a rough ETA so I can set expectations for the public on that?
I missed that question. You were breaking up on my end.
Sorry, can you give me a rough ETA for when you're going to get us answers to our questions we submitted in July?
Hi, Leilani, I could jump in here since I've been working on them. So yeah, so they're in the final process. We were hoping to have them tonight. So we're hoping that by tomorrow, no later than Monday.
Thank you so much, Haley. Just trying to set the stage. That's all, you know?
Understood, 100%.
And also I want to thank Acacia. We will have more questions for you now that you sent this checklist. And we really appreciate your being direct and honest with us. You've heard some specific issues about specific locations. We are going to have those summarized and sent to you so you can respond to those and start to address them. One of the ones I mentioned before is the folks playing outside and the kids outside late at night in front of the Skyline. So that's something that if you can address it, it helps integrate the facility more into the district. So it's managed better. And I think we also heard for the first time this back and forth about elected officials being able to visit these facilities, and I think we're going to have to work through that too. I want to thank all of you for attending this, listening, hearing the questions, and having a solid presentation. It is light years ahead of where we were back in July, and we only look forward to working with you going forward. But I want to end with Katie Savage's comment. It's a big city. We know there's multiple agencies involved. It would be very helpful if you as HRA and DSS and DHS, if there are pieces that we do not understand, other facilities operated by other parts of the city, you've got to get everybody together. So when we have a presentation, we're not in, it's not my job thing. And I know that's not what you're doing, but it's a big problem we're trying to manage, and we need to understand it. And we look forward to working with you. Maria, can you end this on a good note, announce the coat drive that we're doing, we always do every year, that could be useful for the families or individuals in both travel and Skyline.
Yeah, thank you, Joe. Now is a good time to mention it instead at the end of the meeting. So on Saturday, November 19th, between 1 and 5 p.m., people from the community are going to be able to donate gently used or brand new coats and unopened packages of diapers to us at Metro Baptist, CB4 volunteers, and some other volunteers from the community.
Metro Baptist at 410 West 40th Street between 9th and 10th.
Thank you. And then on Sunday, we're having folks from the family sites in the district come and pick them up. And we did it, I think, last year or 2 years ago. I can't even recall right now. However, it's a good event. It's a wonderful event. And the flyers were finalized today. So China.
What's the date again? What's the Sunday date?
The Sunday date is the 20th. So on the November 19th, folks from the community will donate. On Sunday, November 20th, we'll distribute. And I forgot the times for the distribution on Sunday. However, you all be getting flyers. Okay.
Again, thank you all very much from the DHS and Acacia side. We look forward to working with you going forward as problems will, Freddie, as problems arise, we will bring them to you, because what happened was okay today could be not problem, could be a problem tomorrow and then fixed 2 weeks from now. So we really appreciate it.
Absolutely. Thank you. We're here to support.
Thank you all from DHS. We're moving on to our next item, which is minor compared to this. So you folks can withdraw and not have to hear us talk anymore.
Thank
Thanks
you.
for
Have
having
a good
us.
evening, everyone. Take good
Have
care.
a good night, all. Take care. Be safe.
Good night. Be
Good
well.
night.
Have a good night.
Bye.
Good evening.
Good night,
Thank you.
Leilani.
Good night. Take
Good
care.
night. Have a nice evening.
Bye-bye.
Okay, so we have a very short follow-up report about the Slaughterhouse mandatory inclusionary housing application. I feel as if it's become my second job to work with the Slaughterhouse developer on the mandatory inclusionary housing application. We have received, and it'll be in the Dropbox tomorrow, a revised checklist that is clearer and has more information. This is the third version that we've gone through to get to that point. However, the reason the letter was withdrawn from the October meeting is because we still had not settled distribution of apartments. Although the developer committed as part of the ULURP process to distribute the supportive housing units throughout the building, remember we had a hard time figuring out what was supportive versus inclusionary and supportive inclusionary. When I finally got something, everything's on floors 6 to 13. That's not what we agreed to. We're not going to segregate people in this building. This is going to be an integrated building. They responded and now moved it from floors 6 to 20. However, there are 58 floors in this building. So I've asked them to work on this, to give us a specific chart and then floor plans, floor by floor, that states here is something at inclusionary housing at the 90 to 110%, inclusionary housing for supportive, and then non-inclusionary housing. So we can see it visually to understand what it is. And ask their architect specifically to figure out a way to get better integration throughout this building. They expected to have it ready last week on Friday. They informed me they did not have it ready. They expected to be able to meet and present something on Tuesday. They were not ready. And today I informed them that if they do not have something by next week, we're gonna have to defer this again to the December meeting, because the last thing we want to do is go with an incomplete or unclear application and our letter approving. So that's the follow-up report. I'll just take any quick questions on this. It's been a very interesting process with this. Any thoughts or questions? Oh my God, no, that's fantastic. So I will, JD, yes?
Yeah, Joe, is the holdup technical? Just trying to redistribute.
It seems as if the developer was requested by EDC to submit the application before they were ready on the final building layouts. So we've asked them to get as ready as you can, submit, but they've already committed in writing they'll be integrated. We can't approve an unintegrated plan when they've put in writing to us they'll be integrated.
Gotcha. Thanks.
Okay, Maria, we're going to move on to budget. And I also want to note, has everyone seen the letter in the Dropbox from HCC about requesting budget for attorneys for special district enforcement for mixed income buildings? Yes, no? Okay, and how they are not able to be here tonight. They're at a conference upstate, and they will come to our next meeting, but we need to speak about it tonight because it's part of our budget request in order to make it, our timing is off for that. So Maria, take it away.
Joe, do you need me to share my screen? Are you still having trouble with your screen?
No, I can put up the letter. Let's do that first.
Oh, okay. I have the Excel document up.
Yeah, because that's our only new item. And then we can talk about the Excel document.
Okay.
Again, I asked, most people have seen this letter. If people understand what the budget request is.
It's for having additional funding for attorneys, isn't it?
It's for attorney and tenant organizer. And we discovered this matter. Let me just take it down so they'll be seeing at the same time. We discovered the matter in regarding to 410, 412 West 46th Street, that HCCs, the way they are funded now for attorneys to represent tenants in housing court is solely based on an income test. And therefore, if they cannot get people to income test, or they don't have enough percentage of a certain income band, they cannot represent a building, even though in this case, this was a building with tenant harassment, illegal hotels, a fire. They were not able to give them an attorney, which is crazy. In the past, they always had. So that's why we talked to them, understanding the problem, and now we're seeking funding that is not based upon income test. Leslie?
I am wholly in support of this. My building had a number of tenants who fell out from this. So we support this 100%.
Thank you.
I mean, this doesn't need to be voted on. I mean, unless we want to make sure to have a letter documented.
No, it's about putting in the budget. We deal with the budget.
No, understood. But again, since we haven't had a presentation from HCC prior or discussed it, it may be prudent to actually have a letter on record that we're supportive, so that it demonstrates that it is something that has been a community need. The only exception I recall that we've ever just put something directly into a budget request was when principals had sent very specific requests and they were not discussed at ACES directly. But again, that's a suggestion.
Yeah, I think it makes sense to put it on record, right?
Yeah.
Jessica, do you have any thoughts on that?
Thanks, Dolores. I was gonna say the same, both for this and I think as we turn to the budget after this HCC item, the issue of additional funding for asylees and the impact in our district. I don't know if across our different committees, if we feel we have enough on record that can point to that. And so maybe we want to think about a letter that can provide similar backup.
Right. Aurora?
I don't think I can really, if we're voting on it, I just don't think I can vote on it because I'm on the board for HCC. So that, like out there, just in general.
No, you would vote present, not eligible.
Okay, well, I'm
when you're
just
conflicted.
Thank you for pointing that out.
Yes.
I make a motion then that we support the request for the budget for those specific needs for the resource that we have there. Oh, sorry, JD had his hand up before that. Oh, he's seconding. That's a second.
All those in favor of supporting this request? All those opposed? All those present not eligible? Thank you very much.
Sabrina also, okay.
Sabrina, this passes. And now, Maria, let's go to the budget and spreadsheet.
Leslie, do you need your hand up or is that from before?
No, he's bringing it down. Okay.
Oh, he's bringing it down. I was going to ask everyone here. Well, you know what? I'm just going to give my little budget spiel anyway.
Do you want me to put this? Tell me when you want me to put the spreadsheet up. I have it ready.
Okay. I'm going to be totally honest, Joe. I really don't feel like leading this right now, but I'm going to give my little spiel. I just want to give the background because I know like Yadira's new, Aurora's new. And so each year the community boards review a statement of district needs for their communities. Basically, it's just we look at last year's prioritized budget items for the upcoming fiscal year related to our committee. And then we also look at the agency responses to the requested items that we asked for. And then we edit the request for the upcoming fiscal year. It's a really interesting process. Eventually I would say get on, what is it called, Sabrina? How could I forget? I'm on it. The budget committee.
Budget task force.
Budget task force. We're tired, folks.
Yeah.
Led by our second vice chair. That's
led by Leslie right now, right? Yeah. Okay. And so Jessica led it before. I'm glad because it's not something I would ever want to lead. It's kind of long and drawn out, a long conversation. It's really interesting. And so today we're looking over our items that we have here. There's capital items, which have a lifespan of more than 5 years. And then there's expense items. So for example, the HCC letter is referencing having an attorney and I think community organizer that would be under expense. So it's kind of having a discussion about where we're going to put that in. Where are we going to fit that in on the list? Joe, you're going to put it up? Are you able to?
Yeah.
So Maria, can I just add about?
Oh yes, please, Dolores.
Maria, can I just add about capital? One thing to think about capital is like if we're requesting funding for building something, a new school, an actual physical place. So, those are two different categories, but overall, a lot of the discussion that we have throughout the year across all of the committees informs what it is that we request from the specific agencies. But as you are all aware, there are a lot of probable needs that don't come to the community board. So that's why this part is very important, that when the public does attend our meetings, to hear that we do advocate on behalf of the community for budget. And if you are aware of organizations within our community, make sure to have them reach out to us and get on agendas so that we can be on record to advocate for them in the event that it is something deemed a community need.
Right, and I think that's the most important part, which Dolores just mentioned about they have to come before us. We're writing a letter of support, and that's how you end up getting the statement of district needs.
And I want to go back to Jessica for a second. I think you need to make a motion about a letter about funding for the asylum seekers and stuff. So we're on record with that, which we can then bring to executive, maybe to have more than one committee sign on to it, right?
Yeah, I don't know if Betty is still with us, but Betty had actually made the suggestion at our CLUE meeting, which was earlier, this week, where this topic came up as well. And so, yes, I would suggest that we make a motion to write a letter calling not for capital, but rather for expense dollars to allow our appropriate agencies to provide immediate and adequate response to the overwhelming humanitarian crisis that we heard about.
Prior to the members, that would be for schools, for Ryan Health, for the Ryan Health Center, and for the food pantries that we heard about tonight. Is that correct?
Yeah. JD, do you want second? Great.
Yeah, but it would also include, I think what we would have to do is to break that down across all the agencies that would be involved, including social.
Right, of course, right. But I'm saying in general. Sabrina, then Katie.
Just a question. So this will be for city funding, right? We will not be asking to FEMA.
No, I think what we do is I think we asked for the city funding, but our letter is going to have to say about and seek funding through FEMA, like almost to say that, because that's where it's going to come from at the end of the day.
So wait, I'm sorry, I'm confused. So the letter will be addressed to both FEMA and the city?
It's a city budget request, but the city's budget is funded by various federal and state sources. So we would say in the city budget and ask the agencies to seek through FEMA to help fund this request, something like that. It's a little bit weird because normally like.
No, I mean, I don't know. I would certify that because I know it's like, it's sort of separated. It could be from an agency that the agency itself has funding from the federal government, let's say FEMA. But I would say that as a budget perspective, we probably want to have both. Like not.
We already wrote a letter. We wrote a letter, I think, through exec asking for FEMA funding, right, Jessica?
Okay, all right. That's what I was just curious. Okay, so then we just focus on the city. Okay, gotcha.
I think for the purposes of the letter, like I think you're right, Sabrina, we want to keep pushing on the federal piece and figure out what advocacy efforts we can do with our electeds to help push for that. I think for a more procedural piece is for us to be able to have something in our CB4 budget request that we want to be sure we have something else on record that like supports that specific need that we're seeing in our district and be on record with those city agencies that they need to do more to respond to that. And so this is, I think, almost more of just a procedural letter as opposed to that other effort, which is more of an advocacy letter, although hopefully more will come from it, but just as it relates.
Right, but it's like putting on record in the budget. That's the thing.
Exactly.
So different buckets, essentially.
Exactly, you got it. Yes.
Yeah, and I think the budget task force will need to also, maybe with input based on the discussion we had tonight, weigh what are those more specific, or maybe we're going to do that now. What are those more specific requests to DOE, to HRA, to other agencies that oversee those groups that Dolores mentioned, like schools, food pantries, et cetera? Like, do we have specific asks?
Hospitals, all of these different needs. Okay, got it.
Yeah.
Katie?
Yeah, I really appreciate, I think we do have to have a letter saying what we're interested in so that then that can back up our budget request. I do know that on ACEs, we had a meeting earlier this week with the superintendent of District 2 about the schools, and he gave us some specific ideas of what he'd ask us to what he would like us to ask for. And so I think that's really helpful. So I know that'll be discussed at the ACEs meeting on Monday. I was going to say, I really liked what you said, Jessica, about sort of being specific about, supporting the food pantries and the local schools and Ryan Center. Now, I think somebody had said that this wouldn't be a capital request. And I guess just one question that popped into my mind is that, Ryan said earlier how very cramped they are for space and that they have, so many more people, even though, the number he used is that the asylum seekers themselves represent, no 10%. More than 10% increase. Anyway, I guess just my question is, should we be thinking about or
they have to come to us with a much more specific plan. Right.
And that's what I was going to ask, because I haven't made like every meeting this year. I was going to say, is there anything from Ryan that we've seen that have said like,
not
really
yet.
like more space?
No,
nothing
but
other than tonight.
I think that, there's a whole staff at Ryan and board that would need to be consulted, but as they think about meeting this need, expense budgets do allow for the rental of temporary space and other things that they might, like if they had more discretionary dollars that they could use to prioritize how they're going to meet the immediate and short-term need. Any capital dollars both take a really long time, but also there's no capital project there right now. Like they don't have plans for something.
Okay.
If we want to say to them, bring them back and say, we're really interested in understanding your plans. And when you're ready to produce something, this board will be here to support it. Like that kind of thing. I think we can make that clear if it's not already, although I think
it is clear.
Yeah.
They know where
That's great. So you're saying that expense money can be used for like
rental.
Rental. That's awesome.
Yeah.
Great.
Yeah. Which would allow them to meet the influx.
Okay.
So one thing that I've never asked before, Jessica, you just mentioned it. So capital money takes a really long time versus expense to come in?
No, not a long time. It depends upon the project. So,
okay.
So in other words, like the Irish Arts Center had 3 tranches of capital funding over 8 years. And they got all their funding from various locations. And then there was a final little piece from the city that brought them over the end, and the project was able to start. It all depends upon where they are as an organization and figuring out this whole project.
No, Joe, don't forget, any nonprofit is at least 18 months behind from the city and getting paid. So
right.
Any project, I mean, projects, it takes, the budget doesn't get passed and then this money just gets wired into people's accounts. So.
Would that were true, Jessica?
Right. Talk to Brad Lander.
Thank you. Yeah, I just wanted to piggyback on what Jessica was saying. So Katie, you know, it is appropriate. We have in the past advocated for capital for a new school. So particularly when Hudson Yards was coming, before the Hudson Yards came online, the request for a school, a firehouse, a city, and those are things that we know as a community we need. But when it's an individual organization, if they haven't articulated that they have the capacity to do it or whatever, I don't know if it ever makes sense for us to recommend that without knowing whether they can actually get it done. But I do think that the fact that you brought it up, even though for rental that can come out of expense, maybe we need to plant the seed that we have an opportunity to advocate for them and see if they want to think about that and come back to us whenever they can figure out what it is that they would need in terms of a budget for that.
So we have to go to our actual budget document and look at some things about prioritizing.
You want me to share?
All right, Joe, we have a motion and I think we had a second.
Oh, I'm sorry. I'm so sorry.
Oh, we do?
Right.
Yep.
On the asylees, right? On the asylees, yes.
We had a motion for a letter. I think JD seconded. There were a few questions, which I think is okay by process, but you probably want to call for a vote.
I certainly do. And usually I'm the one who says that, Jessica. Thank you for shutting me up. All those in favor of the motion about asking for specific expense and for asylees? Anyone opposed? Anyone present and eligible? One. So record it. Thank you so much. And now we'll share the screen and we can move to this hopefully quickly.
Excuse me, Joe.
Sure. I'm sorry.
I am employed by Ryan Center. Was I supposed to do P&E for that one?
Ryan Center's not asking for anything.
Oh, I told you in my head. Okay.
Oh, no. You would do P&E because we're mentioning Ryan Center in the thing. Yes. Yes.
Oh, yes.
Right.
That's okay. That's what I thought.
Always
right.
better to ask and always better to say P&E when you're not quite questioning, you know.
I am P&E for that.
So
All
record
right.
it.
I am going to share my screen.
I'll put it up and you can talk. Oh, you want to do it? Go ahead.
Yeah, I'll do everything and you're just going to help me through it. If I don't make enough sense. All right. Can y'all see everything on my screen?
Yep.
Okay.
No,
All
we
right.
just see the Excel doc. We don't see if you have personal stuff.
Okay, perfect.
Excel, yes.
That's what I
We
meant.
see that
That's what she meant.
All right, you can see the Excel document. And there's something in my way here. Okay. So the first thing, and this is the capital budget, the first thing we have is the Harborview Terrace, the RFP for the Harborview Terrace.
So we
site.
need to move this. So how these things work is that the city says we can do this or we can't do it. And if they say they can do it, we then move it out of our priority list into continuing support. And this was the surprise that we got, that HPD actually said they will be accommodating this request in this budget year. So for the first time, and this happens, it takes a while, our number one can now move to continuing support because it is being accommodated. It's a rare thing, right, Jessica? It takes a while.
I'm clapping for us all.
So for put it in perspective, the Chelsea Rec Center took 26 years to get to this point. So we're doing good.
And so you see that the next item says number 4 because it's number 4 in the overall statement of district needs. And this is for elevators and
at Harborview.
At Harborview. And what does this say? Oh, this is in the way. Funding for this request cannot be determined at this time. So I guess that's staying right
Definitely
there for
stays,
now.
Yes.
And then let's see, where are we? Number 7, which is our third priority. And this is the MPLP and the SARA program. And I think this is being accommodated in part, but I don't recall which part, Joe.
Yeah, we have not been able to find out. So I'm sorry, this is a Clinton housing project. when we don't know what it is, it's got to stay on the list because accommodated in part's a euphemism for we're going to do something, not all.
Mhm. And then we are up to number 12, which is our 4. This is to HPD, and it is for supportive housing at Hartley House. The request will be accommodated in part. What part do we know? I don't know.
We don't know.
Okay, so that's staying right there. Number 13, Harborview Terrace
Actually,
again.
sorry, Maria,
Okay.
can I ask a quick question?
Of course.
I don't understand. In number 12, it says provide adequate capital subsidy for the senior supportive housing. I don't understand what we're asking for.
Hartley House is being converted to senior supportive housing.
Right.
And social services. So adequate capital support means include it in the budget so it is funded.
Makes sense now?
No, include what in the budget?
Included in our statement
No.
of district.
Yeah, include it in the HPD budget so it is funded.
So you're saying
the city puts up funding to match any income, I believe, or any revenue that would help support the renovation of this building. So the city has not yet put in that money for the budget, so the project cannot go forward. So it is a subsidy on the capital renovations.
Okay. So you're saying the city said it was going to do it, but it isn't doing anything. Yeah.
So the building is going to be renovated, and the expectation is that the renovation will allow for revenue that'll be ongoing, a rent roll, so to speak, when it gets renovated. But in order to ensure that we have all of the supportive facilities, et cetera, if the city adds through the agencies additional funding, they'll be able to fully build out this project with all the support that we need. So we're asking the city to give money to the project.
I think
Have all the
Katie,
support of.
I think Katie's at a much broader question trying to understand this. So I can see in your face, right? When we include projects or locations, we're asking some city agency to provide capital funding through the city's capital budget for that project. That project may have multiple other sources of funding, but this is the city capital funding. And so everything on this list, right? Like for Harborview, let's say Harborview is a public housing development, but also has a large parking lot that's going to be redeveloped. When that redevelopment happens, part of that renovation of the existing Harborview will come from that redevelopment, but we're still asking for a capital portion from the city's capital budget to do work in that location. Because as you know, in affordable housing projects, there's 17 sources of funds, right? The largest in many cases is the city's capital budget through HPD. And that's what all of these items are about that.
Okay.
You're part of the way there, but not.
Yeah.
I want to understand because this is like a key thing.
Well, actually, I guess my question is, I'm wondering with the way this is written, do at least the people that we're asking, do they know what we're asking?
Oh, yes.
That's my big question.
That's the language that is used in this stuff. Yeah.
Okay.
So just let everybody know that it's a specific form because the way that the budget is now done, there's actual buckets and you're pulling down the specific
menus.
bucket, you're pulling down the specific agency, and it has to be in the agency speak. Otherwise, they ignore it. We used to, before it was automated, write literally 40 to 50 page documents with our requests from this
and the
community.
details why and what it was, and that's not done that way anymore.
It was just interesting to me because like the other requests seem to be more specific about what we're asking for. And this one just says, adequate capital subsidy for senior supportive housing. And so I was just like, is there something more specific we can be asking for? But if there isn't, then, and if they know what we're asking for, then good.
So I'm going to move on. Number 13 is Harborview Terrace again, but it's repairs to like their roof, their boiler. You can see what it says. It says it cannot be funded at this time.
And again, for general background, this is all caught up in the redevelopment of the large parking lot, similar to Chelsea NYCHA. So it's very encouraging that number one, saying the city will be funding that large project, because that means it's all going to get tied up together, both the new construction and the existing. That's why we want to keep this toward the top. This is again, a commitment from Hudson Yards from 2005 that we have not been able to get to go.
And I'm going to move up the page for a second. I don't know, Jessica, Dolores, Sabrina, when we had our meeting last week, I cannot recall, there was like 2 items where we were considering changing the agency from HPD to NYCHA, but I cannot recall why.
So
Was it,
yeah, I don't remember either, but
was it this one, number 1?
but I think Jesse's going to give us guidance on that. But
The
again,
first one is HPD.
Yeah.
HPD is the lead on that NYCHA deal.
but either way, I think the task for us on the committee is to note if we agree
Can figure that out
with the order of
The order, yeah.
the order of what these requests are on the overall list. And I think the rest of capital is all continuing support, isn't that right?
It is. You are correct. So can we just skip them?
Yeah.
Okay, great. Thanks. I was afraid somebody would say no. All right, here we are.
If we're not adding, do we have any capital requests that we're adding to this year? No.
We haven't any new capital requests this year.
So are we comfortable keeping it, the list as is?
I think so, but I think
Yeah.
it's up, the task force is going to negotiate.
Oh, for sure, but we should have our, I just
No,
want
that-
to, like, a clue, we wound up moving, we kept the first one, but then when we did actually add something, so that did change things, but we then bumped up the new request to be between the old 1 and 2. We just
Oh,
made
I'm
it
I'm
shorter.
sorry.
I just want to make sure that
Yes,
this group
our
is all
committee-
comfortable.
Yeah, our committee is going to determine what the budget task force is going to, the order it puts it in. So that's for us to decide.
I also know continuing support, one of them's got to come off here.
One of them is coming off. Okay.
Well, that's the slaughterhouse because it's,
Let's see.
you know,
Oh, yes, this one right
yeah,
here.
because this is happening now. So
Remove. Okay.
like there are commitments on the slaughterhouse because of the ULURP.
But one thing that Jesse always recommended until it actually, they've broken ground and everything's happened.
Oh, I see. Yeah.
Continuing
All right.
support
is really like a.
Yeah,
thank
yeah,
you,
got it.
Acknowledging, yes.
But the next one though is going down, sorry. That's the DEP and MTA sites. That can come off because that's decided now.
Oh,
They both were certified.
No, they're both approved by city council. And this is about changing the income bands and that's over. We're done with that.
mhm. Okay. Here we
Something
are.
else though, sorry,
Oh,
something else is that the number of stories is wrong on the slaughterhouse. It
Oh,
says 45, it's 58.
is that something we need to fix?
We will, Maria. we'll
Yes.
Note to have Jesse go ahead and correct.
All right. What's the number of floors, Joe? I just didn't want to write it.
58.
Okay. And then here we are at expense. Let's see if I can do this like speed lightning. All right. So the first one is for DHS and it's to expand street outreach, homeless outreach.
And it's already been funded.
Yeah. So has the next one, which
Yes,
is
it's
number
amazing.
7 in the overall list,
Already been funded, right?
which was, they gave me this, I forgot which one this was.
With apologies, I think that even though they stated from last year that it's already been funded, we still have a need and the need is even higher because of the crisis that we're in. And I don't think that this should come off the list. I think maybe if only thing you change is saying additional, because we still need additional resources. And I don't know, Joe, what are your thoughts on that?
Well, I'm trying to figure out how we have impact, right? If in fact, maybe the budget task force needs to understand what was the funding before in fiscal 22 and what is it now in 23? If there's been a huge increase, then I think we have to admit that something has happened here, right? I just don't know. We have to get that information. These are large budget lines. These are not just for our district, right? And the same thing with the next one, the same thing.
I would also assess the level of it, like the priority, if like it's been funded, but we still have a need, but then we have another need on the expense.
Right, that's right.
Kind of the ranking of it. It's still like I said, additional. And yeah, I think it would be helpful to figure it out.
Like if the funding's been increased like 30%,
Yeah,
It should not be a number one, right?
and that's a public information, so that's,
Yeah.
I can even help getting that information.
Yes, can you, Sabrina, please?
Yeah, this is public record, so I can certainly, as a public record, this information.
Thank you. Oh, let me just write that.
That's
Big capital letters.
That's both for the first and second.
Oh, Sabrina, number 1 and number 7. All right. Thank you, Sabrina. And let's move on. This is number 8 and 17. So for NYCHA, it's the elevator, what they call mechanics. That's the word I'm looking for. The elevator mechanics, and it said it can't be determined at this time.
I would move this to number 1. The people in NYCHA, until they get renovated, are out of their minds every day with this elevator stuff. It's really an ongoing, every single development has this. People are walking up 17 and 18 floors.
So Joe, I don't disagree with you that this is an extremely high priority. But one of the things that has informed the order that the budget task force put this in is the survey that was sent out to the community. And I don't recall, I believe we had, Jessica, do you remember it was 230 responses, but
for this year, yeah.
Yeah, so we had over 200 responses, which is decent. And overarching concern, number one concern happened to be public safety, but there also were a ton of comments relating to the homelessness issue. And while I take nothing away from the real hardship of not having the elevators working properly, there's just so many, we'll call it ripple effects that that occur when we don't address the homelessness issue in the community.
Do we have a sense of what percentage or what number, if any, of the people who completed the surveys live in public housing?
That's a great question. We didn't ask where they resided to that degree.
I just got to ask that from a broad policy and political end, we push this toward the top. I know it's not going to get taken care of in this budget, but the more we bring it up, something may happen here, because Chelsea NYCHA renovations is going to happen, but it's at least 24 months to 30 months off. And Harborview is much longer. So this is how many do we have? We have 230, it's like 2,500 apartments at NYCHA in our district between the 3 developments. I mean,
no, your point's a great point, and that's something that we also take into consideration in the budget task force. If there are political wins that can be pushed by the positioning, that's something to take into account. So if your view as co-chair of the committee feels that us moving this higher up gives it a little bit more of an opportunity for it to get political support, then that makes sense.
With a whole new NYCHA thing that's happening, just to push it along, that's all.
Jessica, do you recall, or Dolores, what the top 3 greatest concerns were in the community from the survey? I wrote it down, but I don't have it in front of me. Do you recall?
Public safety, housing. Jessica.
And then there was like quality of life, but I think there was an issue that when you looked at the responses, there was a lot of ambiguity about what that meant.
Yeah. Yes, that's right.
Yeah,
but I think those are
between like trash and
exactly, and safety, which connected to like, right. But affordable housing was very high.
So
okay,
what do we have for 17 and 18? Are there more?
Yeah, number 17 and 18. So 17 is about really more kinds of social services and supportive services for families and adults that are living in shelter and exiting shelter. They said it had already been funded.
Well, can we make these continuing support, Jessica or Dolores?
I would be open to that.
I mean, if we feel, sorry, not the ones that say this has already been funded. I think if we are satisfied with the amount of funding, but want to continue, like, meaning it's not like the earlier item where you said, I don't know where this is actually funded or if it's actually funded.
Right.
But I think, yeah.
I think we just need a little bit of help to know how much money's been given to it, as well as whether it actually, that amount of money from the last budget has actually met the need. Because I think, again, these are still real needs that need to be met. And maybe they are budgeted already, Joe, but like you pointed out, maybe they can't fill the positions. And maybe that's why they can't get.
Maybe we need also to ask Sabrina to look at all these items here to give us some guidance, because I think if there have been major increases, right? Yeah, the positions aren't filled, but the truth is this is the budget and the money's there. So we need to understand if there's major increases, then we need to say, okay. But if they're not, then we should act differently. This is a little...
There are a few things, right? It could be funded, but like you said, it's not about, like, it takes the time and like the head count and
the whole thing.
And the communication with other agencies, if they're using other resources. Like, it's just such a long process that, the money might be there, but that doesn't necessarily means that, the program restarted it, or it takes longer to actually see if it has any impact to the community or not.
But this document is the budget to get the
it's
money
funded. It's asking money. So it's not about, like, so if it's been funded, like, okay, well, then we need to assess.
Right.
The program is actually working or not, but that's different. That has to do with the funding.
Right.
So my takeaway is for us to take back to Budget Task Force, Maria, Sabrina, and Jessica, is that there are things that are showing that are funded and they would go to continuing support, but we do need a little bit of help from looking at the public record, and also maybe Jesse already doing homework that he may have already done to indicate whether or not the funding is fully funded or whether there's still some needs. And I think, Joe, the thing for the committee is just to decide upon, again, the order. And if we determine that the budget isn't enough for those, are we comfortable with leaving them in the order that they're in?
Can we see the rest of them? Are there more?
Yeah, so 18 and 20 and 29. This one is just more funding for HIV services for, these sites, and it can't be determined, so it's staying. This requires further study. Number 20 requires further study, which is for senior meal programs. Number 29 is code enforcement.
All the code enforcements they're saying they're not doing.
Okay. Which was also the next two.
Next, yeah.
Right?
Next four,
that's right. And where are we? 54. This is the last one. And this is for pollution. But what exactly is this one? I don't remember.
It's pollution monitors in CB4.
Okay.
It's way down the list. For the committee, go for the top, Maria, for a second on the expense side.
Top expense.
If we are able to say that some of these have been funded and they're adequate, where in the grouping do we put the HCC requests for the legal representation and organizing in this? Like, where does that fall in our whole world? Like,
it fits with our housing issues, and housing was number 2 from the community overall. So I think that if we're moving things around for continuing support for these two, and then moving down to the next item, as you had mentioned, Joe, that you believe that the elevators need to still be high up. Again, we have another that's potentially continuing support. And then there is the next item here. I would say that this has been a long-standing request, and it's been there for a while. So in terms of order, perhaps we have to determine whether this stays in the level it is, and then HCC is after this one.
So we go elevators, STIAs, family planning, and then HCC representation and tenant organizing.
Say that again, Joe. What was your suggestion?
That we go with the NYCHA elevators first.
Okay.
We'd move up the information and the services regarding to HIV and AIDS and family planning to to 2 on our list, different on the full board list. And then number 3 would be the HCC representation and organizing. Especially if some of these are going to move down.
Oh,
So it sounds like you're saying the tenant organizing stuff would be above the meals to seniors.
Oh, well, the meals to seniors is way down. That's the problem in the overall budget of the board. It's like it's way down.
It's number 20.
Number 20.
And I think part of the reason why is because the response came back, the request requires further study, which means it's something that they're not going to even consider.
It doesn't mean we don't leave it on, but in terms of like reality to achieve.
Didn't our city council person help had a program for seniors, or that ended with the beginning of the pandemic?
Pandemic ended.
That ended? Okay.
And just a quick thing about what we're asking for about the tenant organizing and stuff, and maybe, well, this is different. But, there's a lot of, but maybe we don't have anything on it specifically. But anyway, there's this whole issue about, the eviction moratorium ending and now a lot more people being at risk of being put on the street. I mean, is there something?
No, see, they're actually funded for that. The right to counsel is how they're funded in majority. So they're assigned cases for those very reasons with city contracts. But when you have problems in buildings that are in a mixed income building that are not eviction related, but are harassment related, they don't have a source of, I didn't realize this until the last month.
Yeah,
But
I mean, I guess
they have heavy duty funding for right to counsel.
Except, I mean, what I've heard is that the lawyers who are funded to be providing that are completely overwhelmed. And
right. Well, yeah,
so,
but that's yeah. But there's a funding stream there. It's like it's real. The problem is there's a volume, which is not the funding stream so much as the volume now.
Which would mean that they would need more funding.
Well, not necessarily, because they could need more funding for heads. So it's funded, right? But the funded would be directed to the program and to the people who's working for that program. But let's say they're overwhelmed, right? So instead of 3 people, they need 5. So actually they would need more funding to include those 2 more people for the overall cost of that program.
Yeah, so I guess I'm just wondering if we should be including.
Underfunded, yeah.
Yeah, they outlined in the letter that it was a specific, the attorneys and then tenant organizer, and they actually put what those salaries would be. So they were very specific in their ask.
Yeah, I had spoken to them about the whole right to counsel, and they said that is the majority they get at this point. And it's really weird because the systems, Katie, it's kind of new. So it's kind of working, kind of not working. But I didn't realize they get assigned people. It's not like people walk in and they just get told you must represent this person or that person. So
one other note is that when we get very specific requests, like this request from HCC, a lot of times because they're very specific, they have opportunities for getting funded. If not from the agency, sometimes an elected will pick that up in the discretionary, and by us having it on the budget request and usually higher up, because that's a quick and easy win for an elected. To say, oh, I'll just put the extra money from my budget in there and I'll look like a hero.
That's a very direct.
Maybe separately, we can just think about maybe later on, maybe for one of our future meetings, checking in to see if that's an issue in our district, is whether or not people who are being evicted.
They're coming in November in November to present.
Lovely.
Perfect.
Okay.
So Maria, let's just do a quick recap on the expense side.
On the expense side, well, I have some questions. I have question marks here because I'm not clear on the expense side. I have that Sabrina's going to be looking into number 1 and 7, which is our number 1 and 2. And I want to follow up with number 17, which is like our number 4 with Jesse.
I think it's the same question. Sabrina's got to follow up on that one too.
Oh, I did. Well, yes, Sabrina, but also I wanted to follow up with Jesse, but I did. Yeah. So those 3. So that would mean I guess the question becomes, is this number 8 going to be number 1 in capital?
So no, it's not capital, it's expense.
That's what I meant. expense, sorry.
So my proposal was that we take this number 8, move it to our number 1. Number 2, the HIV STD family planning to our number 2. And then number 3, the HCC request to our number 3. And then if we get good news that the funding is heavy on the other stuff from Jesse and Sabrina's due diligence, then those become continuing support.
Would it make sense to put the HCC request above the STI, HIV, AIDS, and family planning services because the district survey indicated that housing was a more pressing issue than other issues here?
I put that to the committee for a thought or comment.
I agree with what Roberta's saying.
I think that's a great point, Roberta. It does
makes sense.
It does make sense, and also
I'm seeing some nods.
The request for the funding for the HIV/AIDS and family planning has been on our budget request for many, many, many years. And so again, I think that moving it somewhere else on the list won't have as much of an impact as the suggestion to move a housing request higher up. So great point, Roberta. Thanks.
So,
yes, and it also helps with the middle income in our
the mixed buildings where there's
yes.
low, middle, and moderate. It's like it's a problem.
We have that. Yeah, we have 150 apartments.
All right. So just so I'm clear,
our number 1 is the staff for the NYCHA elevators. Our number
which
2
is number 8. This
right,
one.
Our number 2 is the HCC request, and our number 3 is the STI HIV family planning request. And then the others will stay the same after the due diligence of the community of the continuing support questions. But so just give me a nod if it sounds the right thing. Somebody nod. Okay, good. Given the nods and how exhausted we are, let's take the document down, Maria.
Okay.
And I'm gonna, Roberta.
A quick question. I'm pretty sure that the answer is this is not a budget request, but I do recall the HDFC affordable co-op that came before this board with a request for, I think it was really for an HPD project manager to get assigned to their loan and not actually a budget request, but I did just want to make sure that wasn't.
It is not a budget request. It's just, it's somebody assigned, that's it.
Yes. Yeah. Perfect. Okay. Just wanted to make sure. Thanks.
Motion to adjourn?
No.
Wait, we have to.
Motion to adopt.
Did you guys in land use adopt the budget?
Yes.
Order?
We did.
Oh, you did. Interesting. Okay. Sorry.
So
motion to adopt the order in which we recommended for the budget task force request.
And I would ask the members who are second, and I'm going to ask the members who are P&E to say what's your P&E on, right? So I'm going to go as a thought that it's Aurora is P&E on the HCC item, right?
Correct.
Is anyone P&E? I am P&E on the Clinton housing. Oh, Hector, yes, P&E on NYCHA.
I have a question, because of NYCHA.
No, you are not you have no financial interest. You are a tenant. You are not.
Oh, okay. So I'm good. Okay, good.
And you want to advocate for those elevators.
Yes, definitely.
I am P&E on Hartley House and the 52nd Street buildings. Any other P&E, Maria?
I am P&E on number 18. That includes the Ryan Center.
Excellent.
I am P&E on everything. The truth.
So all those in favor with those P&Es, please raise your hands. All those opposed? All those, and the P&Es we got, abstentions. I want to congratulate our committee. We are 9:29.
Motion to adjourn.
3 full hours. Motion to adjourn. Thank you all so much. Second by the motion.
Second, third, fourth.
Good night.